Good afternoon. This is Senate Education. It's Tuesday afternoon, March 9th at 1:30. Committee, welcome back. Hope everybody had a good week. I'm sure it sounds like they were productive weeks for everybody, not necessarily much relaxation, I'm afraid. Just to get, sort of recap, as well as talk a little bit about what is going to be coming this week. I thought I'd start by reviewing for those watching as well as for all of us. We passed 3 bills out prior to recess: miscellaneous education, S16, and literacy bill. Those bills will be, I know that S16 was directed to appropriations today. The other bills will be on the calendar tomorrow, both of which go to appropriations, and miscellaneous education may also go to finance. For those who are reporting on the floor, Jeannie will provide everybody with a witness list. I will also provide everybody with fiscal notes, as I'm sure the money committees will as well. And happy to support and help anybody in any way as they get ready for their floor reports. It's interesting. I wouldn't consider, I certainly don't consider myself actually far from being, one of the stronger ones on the floor. But some of the best advice I ever received was talk about it like it's a problem that you want to solve. Here's the situation. Here is the solution. So that's just one way for those of you who are thinking about floor reports now and going forward. Bringing us to this week. I'd say there are our final week before crossover. There are a number of things that we're going to be looking at and seeing what we might get done. H81, which we had a walkthrough of last week or the week prior to our departure. We are going to continue and take testimony on that today. That testimony will be interrupted for a little while by S100 because of scheduling, and then we'll return to that. S100, for those of you who don't recall, that is the bill that was sent over to us by Senate Agriculture. We'll do a walkthrough, hear from the agency on that, and then we will also hear from the 2 members of the committee, Senator Pearson and I believe Senator Collimore. Then we'll return to H81. And then later in the day, prior to our adjournment, we will look at S13, and this is the weighting study. What I have done and want to put before everyone this afternoon is during the break, I collected a number of different questions. I know the Pro Tem's office did as well. Some Senate colleagues sent me questions around what might we start to look at as it relates to S13 to kind of keep it going. Is there a way to frame some questions, get some work done this summer around the weighting study, given the time that we're under right now? So what I want to put forward to all of you later on to consider, it'll be the last thing that we work on, is a draft amendment to S13 that I'd like you all to consider and give some thought to. I think a lot of senators have heard from constituents, from other colleagues. There's genuinely, or generally, I feel interest in moving the weighting study work forward, knowing, given the situation that we're in right now with the pandemic and some of our other priorities, not only in this committee, but other committees, instituting all of the research that has been done doesn't seem to make the most sense, particularly since there are several questions out there. And what I've asked Jim to do later today is take us through some of those questions that I've heard and see if we can come up with a group that might work on this over the summer, and then something that we can return to next winter. Other things that you'll be seeing this week, in addition to S100 and H81 and the weighting study, we still need to share with appropriations some language that they would put in the expedited budget bill around what summer program language. You may recall from the letter that we worked on together and sent to appropriations, we requested funding so that students could have a summer that is enriching, restoring, something that kids can connect with other children, and start to, for lack of a better word, heal after having, had a less than ideal academic school year this year and the end of last year. So Appropriations has asked us for some language, some guardrails, some language that they need around the distributing of those funds. And I'll share that with an idea with everybody tomorrow. I don't think it'll come to as much of a surprise. We started looking at some of this language a few weeks ago. So with that, the only other thing I want to mention is that this is the last week before crossover. We may have some later than usual evenings. I certainly am doing my best to make sure that they're not too late. But today, for example, chair's meeting was pushed back until 5 o'clock, giving all chairs an opportunity and committees an opportunity to continue the work that we've started and work that we need to finish. So please know that. And I think there may be a couple of other sort of after 5 o'clock meetings this week. So stay tuned. Feel free to be in contact with me with any questions or concerns. I also recognize senators are being pulled in different directions into other committees, other meetings right now, given it's the last week. So I recognize that that may happen from time to time as well, and would just appreciate a heads up when you can provide it. With that, senators, any questions? Okay, all right. Thank you. So let's move into H81. This is something, again, that we started talking about the week prior to our departure, that Friday. This is an act relating to statewide public school employee health benefits. We have heard from Jim Demaray, our alleged counsel. Today, we are going to hear from school board members, and as well as I believe we are also going to hear, yes, later on from Jeff Fannin, the executive director of the NEA. So with that, I'm going to turn it over to Ms. Burkhart. Ms. Burkhart, there you are. Welcome to Senate Education. We have about a little less than an hour, given that we do have Secretary French coming in. Actually, we have Secretary French coming in at 2:15. Well, let's backtrack. We have to start taking testimony on S100 because of scheduling at 2:15. We will return to this topic at about 3:15. So those of you who might have to jump off and then jump back on, I apologize, but we have to work around, and understandably, other people in the agencies and our attorney's schedule. So with that, Ms. Burkhart.
Thank you very much, Senator Campion. Thank you to all of the members of the Senate Education Committee for taking the time to hear testimony on H81. The key points that I'd like to make today are, one, that the rising healthcare costs that we are experiencing in Vermont are crowding out opportunities for students and increasing operational risk in school districts across the state. Number two, one important reason for moving healthcare negotiations to the state level was to balance cost containment with appropriate access to healthcare benefits for school employees. Number three, since districts no longer have the ability to negotiate healthcare benefits, we're relying on the commission to do so. And it is important to districts that cost containment is at least considered when determining which last best offer to choose if the process comes to that. At the very least, the arbitrator should have the appropriate data in front of him or her when making a decision that will impact school districts in every community in Vermont. So we urge you to make sure that the arbitrator has that information by amending H81 as suggested in my written testimony. To illustrate these points, I'd like to share with you some information regarding the impact of rising healthcare costs in the South Burlington School District. Healthcare costs have been rising over the past several years. Monthly premiums have gone up by double digits or close to double digits in each of the past 4 years, 10.1%, 11.8%, 12.9%, and finally for FY22, 9.6%. Annual premiums did go down in FY18 and 19 with the introduction of new high deductible plans. However, the state clawed back hundreds of thousands of dollars of those savings during each of those 2 years, meaning that local taxpayers saw little benefit from shifting to the new plans. The structure of the health reimbursement arrangements negotiated across the state has contributed to significant increases in the cost of the health plans. As of FY22, if the announced rates are approved, premiums will be higher than they were under the old low deductible plans, and the district will be on the hook for 84% first dollar of out-of-pocket expenses, ranging from $2,500 for a single plan to $5,000 for the plans that include more than one member. The arbitrator's award is particularly problematic for South Burlington. Teachers and staff in our district were paying first dollar out of pocket, and the award changed that to last dollar. The most exposure any employee will have to out-of-pocket expenses will be $800, no matter how many family members are included on their plan, and for single teachers, no more than $400 per year. The change to first dollar out of pocket and higher premium rates meant that as the district prepared its FY21 budget, it expected healthcare costs to increase by $1 million, or 17.7% versus FY20. That represented a 2% of the FY20 budget. So in other words, before we could even talk about salary increases or additional programming for supports for our students or maintenance of our aging buildings, we were starting with a 2% increase in our expense budget for FY21 out of the gate. For further context, our expense budget had gone up on average 3% over each of the previous 8 years. Given increasing enrollment, increasing needs for a range of services amongst our students, and a range of other pressures on the budget, the initial proposed budget had an increase of about 8% in expenses. Unfortunately, for the children of South Burlington, taxpayers soundly rejected both our initial budget and a large bond that we had proposed to fund the rebuilding of our middle and high school campus. The pandemic hit just after the first vote, causing additional anxiety in the community regarding the budget. It took us 2 more votes to pass a budget that finally came in at an increase of 1.52% in expenses. After staffing cuts in the final revised budget, the district expects to pay $842,000 more in healthcare expenses in FY21 than it did in FY20, an increase of 14.4% and 1.63% of the FY20 budget. So how could we pay 1.63% in increased healthcare expenses, but only have a budget increase of 1.52%? It required a very painful process of cutting back the budget and then cutting it back some more. Administrators were asked to create a list of potential cuts and prioritize them according to those that least impacted student experience directly first, and then moving on to more and more direct cuts to student programs and supports. The board, administration, and community used that list in a series of meetings to discuss the consequences of each potential cut and to pare back the budget. In the end, the cuts were extremely impactful. $830,000 in programming and service reductions. This impacted things like athletics and student activities at the middle and high schools. We reduced math and literacy coaching at the elementary and high school levels. There are fewer emotional supports and social emotional supports for the kids this year, despite what's going on with the pandemic. Driver's education got cut back, which impacted families with fewer financial resources more heavily than those families that didn't, because it meant longer waits for school-provided driver's education. So kids are going to have to wait longer to get their licenses, and some won't get them until their senior year. Family and consumer sciences at the middle school was cut. Arts education, business education, and health education all took cuts. The Big Picture program, which is a unique flexible pathways program in the high school, has room for fewer students, and certain AP classes were cut back. AP European History, AP Chem, and AP Calculus BC is only being offered remotely. In addition, we had to make $1.1 million in operational cuts, which increases our operational risk as a district in a very tough year. Fewer HR staff, fewer IT staff, fewer transportation staff have all made people's jobs very, very challenging this year, especially given the pandemic. In addition, we cut back $1.3 million in previously proposed new expenses. Our administrators and our non-union support staff took salary freezes. We reduced contingencies and negotiations for teachers and support staff who we were still working with to get contracts in place. We hired fewer new teachers than we had hoped to in order to address enrollment growth at the elementary schools. And we delayed a lot of purchases of software and other maintenance on IT and buildings. Taxpayers will not continue to support education budgets that are growing significantly faster than their own incomes. Given that we are limited in what we can ask in terms of increases from the community, it becomes a matter of resource allocation. If healthcare costs continue to grow faster than our overall budget grows, healthcare will take up a larger and larger percentage of our budget. In FY19, it was budgeted at 10.7% of total expenses. For FY20, it was 11.3. For FY21, it was 12.8. And in FY22, it's projected to be 13.3% of our overall budget.
Ms. Burkhart,
yes.
may I just stop you right there? I'm sorry to interrupt, but you're on a really interesting point that I would love for you to pull apart a little bit for us.
Yes.
If I'm understanding you correctly, you believe that H81 in some ways, as you talk about healthcare costs,
yes,
would not allow for the controlling of healthcare costs that Act 11 does allow? Can you just help us out? I mean, it sounds to me like you're talking about, and correct me if I'm wrong, please. I'm trying to understand this as much as everyone else. You're talking about healthcare costs.
Yes.
Healthcare costs aren't things that, from where I'm sitting, the state can really control a lot, but it sounds like there's something that's happening now that is allowing for the control of healthcare costs, but then H81 might come in and deter that?
I would actually say that Act 11 did not go far enough in controlling healthcare costs, and H81 does not then add to that element of cost containment. So we're not saying that cost containment should be the only thing that's considered, but there needs to be some balance between access to appropriate benefits and cost containment. So what happened, very simplified, and other folks who are testifying later might add some color to it. Right. In Act 11, as you know, the process between the employers and the employees came down to an arbitrator's decision. And that arbitrator was told that they needed to choose one side versus the other. They couldn't sort of pick and choose different elements of each side's proposal. He had to take one last best offer or the other. And there was no mandate in Act 11 that he consider cost containment as one of the elements that he was reviewing when he was choosing those offers. He really had to make a choice between those two offers. What we're saying is that H81 should be amended to make sure that the arbitrator has the right information in front of him or her to understand what the impact on the overall cost of healthcare will be for each side's proposal. That's where our concern really is about H81. And that's why I'm dwelling so much on what healthcare costs are right now and how they're rising. Part of the problem, as I glossed over at the beginning, and I think Laura Suarez will hit it a little bit more in detail in her testimony, is that the way HRAs are structured in the current health plan, the one that was chosen by the arbitrator, it doesn't really provide incentive for employees to focus on their healthcare and become educated consumers of healthcare. And so because people are using healthcare without any impact to their wallets, really, it is driving up the cost of the health plans themselves. So the structure of that final decision by the arbitrator, if that's what it comes to, and it given our past history, will likely come to that. We just want to make sure that the arbitrator is at least considering what the financial impact is going to be for districts across the state when they make that decision.
Thank you. Questions for Ms. Burkhart? Senator Hooker.
I do have a question. Thank you. Thank you, Bridget. So you don't feel that because of Act 11, arbitrators will have the information that they need? I mean, they have they're asked to look at the negotiations with a view towards, the impact that it's going to have on the ed fund, on the school districts. So what other, I guess, where else would the information come from? What other information?
So in my written testimony, that was part of the letter that I sent to all of you, what we're asking to be added to H81. So there's a section of H81 that reads, in reaching a decision, the arbitrator or arbitrators shall, and in the new language we're asking for is determine which of the two submissions most appropriately balances appropriate access to healthcare benefits and reasonable cost containment to ensure financial sustainability of the plan. The arbitrator or arbitrator shall also give weight to the evidence, documents, written material, and arguments presented, as well as the following factors. And then two additional factors that we would like to see added are number number 6, the actuarial value of the health benefits for the full term of the award proposed by each party as compared to health plans available through Vermont Health Connect. And 7, the percentage increase or decrease in education spending that is likely to occur under either party's proposal for the full term of the award as compared to overall economic growth for the state of Vermont. So basically what we're asking for is to do a little bit more analysis of what the long-term, the full cost over the term of the award is going to be. We just don't feel that that was appropriately considered in the last round when the arbitrator made the decision.
Okay. Thank you.
Other questions for Ms. Burkhart? Witnesses, please, going forward only because, as you can imagine, the volume of emails and testimony we are making our way through. Please don't assume that we have read all of the testimony. If you would please just kind of go back to what I consider as I mentioned, I think you were all here when I said, the best way for a presentation sometimes in the Senate is former Senator Bill Doyle's process, which is, here's the problem, here's our solution. This is what we're seeing. This is what happened with Act 11. This is why things may have gone well or didn't go well. H81, these are some of our concerns, and this is what we believe to be a possible solution. So I would just, if I may, give everybody that guidance, and I think that will help us. Senator Chittenden.
So thank you, Chair Burkhart, for being here today. What I've seen as an argument to question some of the language you put forward is that the other 3 statutes on hand for negotiating with labor does not have this rigor, this degree of cost emphasis. Why would you argue that the healthcare negotiations demand or are worthy of these additional thresholds, hurdles, or bars to achieve when it comes to consideration of costs over and above what's already in Act 11 and already in statute?
I would argue, just because I would argue that the results of Act 11 so far would demand a higher bar. We didn't feel like the arbitrator gave us any real reasoning in his decision. He just sort of chose one side or the other. We didn't feel as districts that we could explain it to taxpayers. We didn't really have a good sense of why that decision was made the way it was. And now that it's out of our hands, we are having to basically move our budget around whatever comes down from that negotiating process. And so we've essentially entrusted a very big part of our negotiations with our employees to the state. And we would like to see that level of analysis to make sure that they're acting in the best interest of the districts.
Senator Lyons.
Thank you. First of all, you have pointed out what we all know about the rising costs of healthcare, and we appreciate that. My question is, couldn't you, as a negotiator, provide the information that you are asking for? So, if there was an interest in having an actuarial analysis on the proposals, either or both of the proposals, isn't that something that you could prepare and offer in as evidence during the negotiation process?
I would defer to some of the later folks, Joe McNeil, or I believe Elizabeth Fitzgerald, who's on the commission, will be testifying in the second part of the day. I would defer to those who are actually in that negotiating process to give you better color about how information is considered or not considered by the arbitrator. I don't know if Joe wants to take that question now, or if we want to wait for Elizabeth at some other point.
Mr. McNeil, would you like to take that question? I'm afraid you're muted, sir. Now you're
Thank
unmuted.
you.
Yep.
Thank you, Mr. Chairman. Senator Lyons, the quick answer is that, yes, you're right. That information could be presented to the arbitrator, but that doesn't mean necessarily that the arbitrator would take it into account in the decision making. The decision that the arbitrator gave in round 1 was essentially, I've looked at both parties' submissions, I compared them to the statute, and I'm picking the union side because I think it's closer to the statute. That was the depth of the analysis. And what we're looking for, consequently, is not only the submission of the information, but the fact that it would be taken into account in the decision making. And that results in the two components that Chair Burkhart was talking about. Number one, indication that there should be a proper balancing of cost containment with access considerations. And then number two, the criteria that she went over.
Thank you. Other questions for Ms. Burkhart? Please, Senator Pearson.
Just on that point about the decision that the arbitrator gave, or what we were calling last thing is like the non-decision, because it was just a couple sentences. But my understanding is that is corrected with H81 separately from the question about the healthcare costs. Am I not right?
You're correct, Senator Perchik, that the bill does now require the arbitrator or arbitration panel to give what's called a full explication of their analysis. So that part is correct. What it doesn't do is add that the analysis would take into account this balancing that we're requesting and the specific criteria like the impact on education spending and the AV values of the plans.
Just to follow up, Mr. Chair. I mean, I understand what you guys are asking for, but I think it's difficult. And I guess I don't understand why what's in there now is not sufficient, where it says that the financial ability of the fund and the school districts across the state to pay for the cost of healthcare benefits and coverage. Like, why isn't that sufficient? They're obviously, the arbitrator has to, well, hopefully you guys, the parties will just negotiate it and we won't have to go to the arbitrator. But if you do go to the arbitrator, then why isn't just like saying you got to take into account that the costs of these healthcare programs? Why is that not sufficient? Which is
again, respectfully, the first round, even though most of those criteria were present, did not result in a decision which reflected any analysis. And we had between the two parties, there were like 3 or 4 long days of testimony, at least 2 of them going from like 8 in the morning till 10 at night, with a great deal of expert analysis made available. And then there was a dearth of analysis that we saw. So, and we're reflecting back on Act 85, which preceded Act 11, and thinking that the basic balancing here is between trying to make sure educational employees do have access to quality health care on the one hand, and number 2, that we've got a plan that is sustainable and with reasonable appearance of cost containment. And we're hopeful that that basic, if you will, philosophy that was Act 85 into Act 11 into the commission is reflected more concretely in the bill.
Other questions for Ms. Burkhart? Senator Chinden, please.
I have to leave after this question, but maybe it's to Mr. McNeil or maybe to Chair Burkhart. I've heard in what you said, Chair Burkhart, that the reason to go to a statewide negotiation for healthcare wasn't just cost containment, that it was also for equity and also for higher quality of negotiated services for maybe the same price. Is that the general sense of why we went to statewide, or was it in fact a cost impetus that the healthcare costs are rising so highly that this was entirely taken upon in order to contain costs, or was it multifaceted in why we went to a state healthcare negotiated contract with our teachers?
I can give you my opinion. You might want to ask opinions of other folks who are testifying. I think cost containment was the big reason. That was the big push. But I do think that there was a dramatic difference between districts in different areas about what they were providing or not providing. And I do think to a certain extent it was to make sure that all school employees were able to access healthcare appropriately. Not that anyone wasn't getting healthcare, but the terms of that healthcare varied widely across districts. And I think this was meant to a certain extent to be an act of fairness to bring those into balance.
Thank you. That's very helpful. I need to depart, but I'll be back around 3. My apologies.
Okay. Ms. Soares, am I pronouncing your last name correctly?
Yes, thank you.
Great. Thanks for being with us. Before you start, I'm wondering if you would please tell the committee what would happen. Give us a couple of scenarios of what would happen if H81 passes.
As it is today.
As it is today, the governor signs it. What happens?
Well, I think that it will have made some improvements of Act 11.
Okay, that's good to know.
I think it will perhaps give a false sense that balancing costs is not a critical component that needs to be taken into account. And it may lead to a lost opportunity to control health costs to a degree. Now, my testimony, I realize, might be interrupted and need to be broken into 2 parts, but one of the things that I wanted to speak about is that the decisions made by the committee does have the potential to slow healthcare increases or to speed healthcare increases. There is a direct connection to the out-of-pocket cost HRAs that are shared or determined by the commission and future premium increases. So I worry about lost opportunity, and I worry that we've given a message that cost is not a critical component. One of the things that I expected from a state commission was that a group of 10 thoughtful individuals would be able to delve into the long-term statewide implications of their decisions in a way that hundreds of school employees and local union leaders aren't able to in making healthcare decisions. So we saw uneven healthcare decisions, and we saw healthcare decisions that, it's the tragedy of the commons concept where everybody makes a decision that makes sense for their own local entity, but taken together actually is a challenge for the state as a whole, the community as a whole, the education fund as a whole. So I expected the commission to be more thoughtful and to take into account some factors that I think this law has the opportunity to emphasize as important.
Thank you.
So,
Please, Senator Hooker.
so to follow up on your question, Senator Campion, so what happens if we don't pass this law, this bill? How are the people who are who the bill is intended to help, how are they affected? How are the lower paid ed employees affected if the bill doesn't pass?
So, and maybe I can speak to some of my written testimony that could sort of help with that. But one of the changes that this makes is that premium share does not have to be the same across all school employees. The current law requires, Act 11 required, 1 transition round, which we just completed, and then everyone have the same premium share. And it also requires, without this bill, that everyone would have the same out-of-pocket cost share. Now, people have had the same out-of-pocket cost share until 2021. And I can speak to that. And before VI had new health plans, everybody had the same out-of-pocket cost share in the health plan. Employers didn't help with out-of-pocket at all. You paid your co-pays, you paid your prescription co-pays, you paid any deductible you had. It was all on the employee. There were no HRAs. And as employers moved to HRAs in 2018, what my understanding is from talking to school districts across the state is that by and large, school districts gave the HRAs the same value HRAs to the different employee groups. So that going to that same out-of-pocket cost share that the Act 11 requires is actually not any different than the history, nor any different than state employees are treated. So that, that part would change. I would like to show you, if I can have the opportunity, that that health plans today, that the health costs for employees today is actually less than they were responsible for in 2017. That all of the cost increases that have come from healthcare have actually gone to the employer side of the ledger since 2017. And I can give you some specifics on that if you would like. And I could talk on this for 3 days, and I know our time is limited. So I'm going to stop there for a moment because I've.
Thank you.
Senator Terenzini.
Thank you, Senator Campion. I guess I have a question for the committee or the room here, but does anyone truly know, 2, 3, 5 years down the road, what does this do to the average Vermont taxpayer? I mean, I understand that the JFO has not done a full fiscal note on this yet. They may have, I heard, put some type of a briefing or memo together, but not a full fiscal note, from my understanding. And my question is, like everybody on this committee, I've received over the last few days a tremendous amount of emails from folks about it. And I guess I always come back when making a decision to what is it going to do to the average Vermonter and their tax dollars? Because we know that many people feel that property taxes are through the roof, and it's 85% of your tax bill is on the education side. So I don't know who I'm asking that question to. I just posed the statement in question to the committee to say, what do we know about this 5 years down the road?
Yeah, thanks for the question, Senator Terenzini. I'm hoping, first of all, Ms. Soares very well may also have a response, but I have asked Joint Fiscal to come in tomorrow and share with us what I think will now be a completed fiscal note. You're right. I think they've been sort of working on it. And I did invite them in tomorrow. So hopefully we will get a better sense tomorrow, which I think might help you and others with that. Ms. Soares, did you want to weigh in on that as well?
I mean, I think that you're correct that we need to consider the taxpayer's ability to pay, as well as maintaining high quality access to healthcare for school employees. One of the things that just was accomplished in the first round is that all school employees, regardless of position, have access to the same health coverage. So everybody has the employer helping with a family plan if that's what you need, and that was not always the case. Everybody has that employer help at 17 and a half hours of employment. So part-time employees have that help, and part-time employees get the full HRA value. So we've done some things to make sure that we've got equity and access for all school employees. And my worry is if this bill, Act 81, does not re-emphasize that has to be balanced against the long-term ability to pay, and that the arbitrator doesn't have to explicitly consider it, that we could have higher than needed property taxes for the foreseeable future. Now, again, if an arbitrator has to pick, they may pick the union position again, and that may be a very rational decision for them to make. I think that the argument is they need to have clear, explicit instructions to balance and consider all of these aspects, and that was missing in Act 11.
Thank you. Please continue, Ms. Soares.
So there were 4 things. I listened to the introduction of the bill before town meeting. There were 4 things I wanted to speak to. One is to talk briefly about the fact that, as I said, school employees are actually paying less for healthcare now than they were in 2017 as a group. And that all of the cost increases, and VHI has had double-digit increases for the last 4 years, has gone on to the employer side. And if you had taken the plan that most school employees were in 2017, it was called the VHP, and assumed just a 6 1/3% increase every year in premiums, which is sort of an average minimum increase in healthcare. And school employees were paying 17% of that health premium. They would be paying $250 more for a single plan than they are right now, paying 20% of the gold CDHP. And if they were in a family plan, they would be paying $420 more in a year than they are 20% of the gold CDHP. So people may be paying a greater premium share now, but they're paying less dollars in premium than if they had stayed in the old plan and it had been adjusted for 2021. Keep forgetting what year I'm in. In addition, as I said, all of the out-of-pocket costs would have been paid for by the employee. They didn't have any employer help with out-of-pocket costs in that health plan. But now, actually, and I'm going to share my screen, we know that all employees have access to an HRA. And this is an unlicensed employee and a single plan to show what they have in out-of-pocket cost assistance. It's really interesting to me, at least. So they have an HRA that's actually worth $2,200, represented by the blue bars. So the first, and the HRA has to be totally used up before the employee pays anything. And VHI pays for a lot of things itself, the health plan. So VHI pays 100% of all preventative care and screenings and wellness prescriptions. Then the HRA pays the first $1,800, the whole deductible of any medical or pharmacy care you need. And then VHI, which is the yellow, and the HRA split the next $2,000 worth of health or pharmacy benefits through coinsurance. So a single person would have to need $3,800 in health coverage before they start to spend any of their out-of-pocket. And then they would have a $300 out-of-pocket, but they wouldn't have the whole thing at once because they'd share the next $1,500 of cost with VHI, and VHI would pay 80% of it. So in order for that school employee to pay $300 in out-of-pocket, they would have had to need altogether $5,300 in healthcare. And that's similar, although I'm not going to go through all of it. It's similar for a family plan. It's similar for a licensed employee. So what that means is even if you are a unlicensed employee who needs a lot of healthcare, you've got a child with asthma, you have cancer, you have a premature baby, you're in a car accident, any of these horrible things that we can imagine that scare all of us at night, you have COVID-19, right? Even if you're had that, right now a single employee with premium at 20% premium share, even though many unlicensed employees don't yet pay 20%. I assumed a worst case. You pay 20% of your premium, you need to pay your entire out-of-pocket cost. You are going to pay $2,128 in the entire 2021 for all the healthcare you need. If you had been in that VHP, you would be paying almost $2,500 for that healthcare, about $350 more than you are now. Now, you think about how much you pay your family for your premium and how much out of pocket you might have to spend and see how that compares. An unlicensed employee in a family obviously has more of an expense, but they are still would not have to spend more than $5,660 for premium and maximum $600 out of pocket cost. And that would give them all the medical care they need in a year. So the exposure, the increases that have been happening have been shifted to the employer side of the ledger in the last 5 years. And that increases the burden on budgets, as Bridget talked about, and on taxpayers that the senator brought up. And also, as I said previously, school employees have never had out-of-pocket cost help from employers until 2018 when HRAs came on the scene. And most employers didn't differentiate HRAs by class of employees. Premium share, but not HRAs. So we have very generous health benefits available now. And as we talk about protecting employees, I think we need to balance that with protecting school budgets and protecting taxpayers. So before I talked about actuarial value, I wanted to sort of check in and see what your time frame was. I think it's 2:15. And you're on, yeah.
It is 2:15, and I do apologize that we do need to shift, but we do hope this is an important conversation, and one that we're going to continue after we take this shift over to S100. And I do apologize for the interruption. I know it's not ideal, but as I said at the start of the committee meeting, it's that time of year for the Senate, legislature, and we have to get our lawyers and our people whenever we can.
Of course.
Ms. Soares, I do want to just end with one question, if I may, and that is, did you support last year's bill? The last year's bill as in...
Yeah, I know, 223 or something like that in the Senate.
Yeah.
I did not testify.
Yeah.
Personally, I did not, because I felt that it did not achieve the balancing that, and my hope had been the House would have picked it up, but then of course the virus has put everything on its head. So here we are.
Yeah. Very helpful. So we are committee going to pause. Again, witnesses, please feel free to stay on. What is coming up, I suspect, is also of interest to all of you. We are looking at S100, and I know that we are hearing from your representative in the building tomorrow. I believe Ms. Siglowski is coming in to talk to us tomorrow about S100. But if we may, I'd like to switch to Ms. Carby. Are you with us?
I am.
Great. Thanks for joining us. So, as I mentioned, or I don't know if folks know this, but Jim Demaray could not be with us at this point. So Ms. Carby is going to take us through S100. And then we are going to hear from Secretary French, and then we will hear from the bill sponsors. So with that, Ms. Carby, if you don't mind.
Thank you, Jennifer Carby, Legislative Counsel. And do you like to put the language up or just?
I think that would be helpful.
Pull it up and then, oh great, and Jeannie just made me a co-host. There we go. Can you see that language now?
Yes, and if I may, before you get started, for new senators, this bill again was voted out of the Agriculture Committee because there is overlap with the Agency of Education and education policy. It was directed to us. So with that, Ms. Carby, take it away.
Great. Jennifer Carby, Legislative Counsel. So this is S100. It was introduced by the Committee on Agriculture as a committee bill. And it is an act relating to universal school breakfast and lunch for all public school students and to creating incentives for schools to purchase locally produced foods. It starts out with a title for the bill, the Farm Fresh School Meals for All. And then it makes some changes in an existing subchapter of Title 16 on school food programs. The first changes, as I understand them, are just some technical changes in the definitions section. But the next piece, 1262A, adds in a new subsection D, requiring the Agency of Education from funds appropriated to it to award grants to supervisory unions and supervisory districts in accordance with what we'll look at under locally produced foods. If the amount appropriated is not sufficient to fully fund the grants, then the grant amounts awarded would be prorated. Then in the food program section of the existing statute, first, it requires under existing law, each school board that operates a public school must cause to operate within the school district a food program. This changes that to be specifically each school in the school district must operate or cause to operate a food program that makes available the school lunch for each attending student who qualifies for the free and reduced price lunch program every school day, and it directs school districts to maximize their access to federal funds for the costs of those meals. But then in addition, it also requires each school board to cause to operate within its school district the same school lunch and school breakfast program made available to students who qualify for free and reduced price lunches under the federal programs to each attending student every school day at no charge. So the upshot of this is that all students would receive at no out-of-pocket, no charge to them, breakfast and lunch at school every day or have access to. And to the extent that the costs are not reimbursed by federal or state funds or other sources, the costs for making those lunches and breakfasts available at no charge would be borne by the districts. It directs the school districts in operating these programs to seek to achieve the highest level of student participation, which can take different forms, might include having kind of grab and go or breakfast meals that can be picked up by students, making breakfast available to students in the classrooms after the school day begins, collaborating with the school's wellness community advisory committee, if it has one, in planning the school meals. And that's an including, so it could be other things as well. And then it directs the school districts to request that parents and guardians complete the household income form provided by the Agency of Education, which is used to determine the family's economic status to see if they are eligible for various state and federal programs. That's not required if they obtain equivalent information through another means, and you'll see later in the bill there is a way to obtain that information. Then it strikes through some existing language around purchase of local foods for school meal programs, but it actually moves those provisions and moves the date out a year in this next section. So it's not completely doing away with those, but really moving them and moving the date out. And so this would be a new section in this subchapter. Starts with a goal of the state that by the year 2023, at least 20% of all foods purchased by supervisory unions and supervisory districts, which it then goes on to call supervisory unions, would be locally produced foods. And in this piece, this part of this section, it gives the school board's discretion to define what foods are included in the definition of locally produced foods for purposes of subsections A and B, and you'll see there's a difference coming up for another section, another part of this. By on or before December 31st of this year, and then annually thereafter, a school board that operates a school lunch, breakfast, or summer meals program must report to the Agency of Education an estimate of the percentage of the cost of all foods that the school board has purchased for those programs that were locally produced foods during the previous 1 year period that ended on June 30th. And then beginning with the 2021-22 school year and thereafter, supervisory unions would be eligible for a local foods incentive grant from funds appropriated to the Agency of Education for that purpose. It allows the supervisory union to apply for the grant if it has developed a locally produced foods purchasing plan that describes its goals for purchasing locally produced foods and its plan to achieve those goals. If it's designated someone to be the food coordinator for locally produced foods who would be responsible for implementing the plan, that has developed a process to track the purchase of locally produced foods, and if it has complied with the reporting requirement that you'll see coming up later. A supervisory union that has satisfied those conditions may on or before January 15th of next year or on or before January 15th of any year after that, apply to the agency for a grant by submitting a certification signed by its business manager that it satisfies that list of conditions. If a supervisory union is eligible for a grant under subdivision 3, the agency would make the grant payment subject to appropriation by the following March 31st after submission of the application. So the application is due by January 15th. That the grant payment would come by March 31st, which would be equal to 15 cents per reimbursable school lunch served by the supervisory union in the prior school year. This is a one-time grant, so a supervisory union can apply for this grant and receive the funding only once under this part of it. But then a supervisory union that has received a grant under subdivision 4, if they've received that one-time kind of gateway grant, then they may, on or before January 15th of 2023, the following year, or on or before January 15th of any year after that, apply for a further grant by submitting information to the Agency of Education demonstrating that at least 15% of the cost of all foods purchased or grown, raised, or produced by the supervisory union during the prior fiscal year, the one-year period ending on June 30th, were local to Vermont as defined in Vermont statute in Title IX, which has an extensive definition of locally produced or Vermont produced foods, excluding, so the things that would not count toward that 15% local, excludes foods that were purchased or grown, raised, or produced by the supervisory union that were used for catering services for which the supervisory union received compensation. So if they already got paid for those because they were part of catering, it would not count toward that 15% threshold. And also fluid milk would not count toward that 15% local threshold. If a supervisory union grows, raises, or produces food, it's directed to assign a fair market value to the food for purposes of reporting the cost. And then subdivision C here would require a vendor that contracts with the supervisory union to supply food products to certify which of its food products meet the definition of local to Vermont, taking into account those exclusions for what the catering and the fluid milk that don't count. If a supervisory union is eligible for a grant under this subdivision 5, then the agency would on or before the following April 30th after submission of the application, the one that's again due on January 15th, make the grant payment subject to appropriation, and the amount is determined as follows. 15 cents per reimbursable school lunch for supervisory unions purchasing at least 15% locally produced foods, 20 cents per reimbursable lunch for supervisory unions that purchased at least 20% locally produced foods, or 25% per reimbursable school lunch for supervisory unions purchasing at least 25% locally produced foods. It allows for us, so under this one, a supervisory union may apply for and receive grant funding for each year that it qualifies for the grant funding. So the first one was a one-time grant. This one you can get year after year, assuming you meet the criteria. And for applications covering the 2020-2021 school year, meals received through the Summer Food Service Program would also be counted for the grant payment. It allows the Agency of Education to perform sample audits for any year that it pays grants to supervisory unions to verify the accuracy of the information. If there is an over or under payment, then the agency can either seek reimbursement for an overpayment, reimburse the supervisory union for an underpayment, or adjust future grant amounts accordingly. It would require on or before January 31st, 2022, and annually after that the agency submit to this committee, to the Agriculture Committee, and to the corresponding House committees in an aggregated form the information received from supervisory unions about the percentage of locally produced foods as the supervisory unions define them that were reported, and the percentage of the locally produced foods using the grant funding definition that were reported, and the amount of grant funding paid under that part of the program. And it would be an ongoing report. Section 1265, which would be repealed. There is currently an optional one-year exemption from providing food program that would go away under this bill. And then we get to definition of education spending, section 3 of the bill basically just says costs incurred by a school district or supervisory union to provide school breakfast and lunch don't count toward the excess spending cap. So they don't count toward the cap in determining whether a district has exceeded the excess spending threshold. Section 4 would direct the Secretary of Education to come up with a definition of student poverty for purposes of determining qualification for federal funds by school districts, establish the data that school districts need to collect to qualify for federal funds based on student poverty, and how to collect the data and how often, and determine how that information would be reported to the Agency of Education by school districts and how frequently that reporting would occur. And it requires the districts to collect data that is necessary to qualify for federal funds based on student poverty and report the data to the agency in accordance with subsection A. Section 5 is a section that would specify that a school district must count time spent by students consuming school meals during class as instructional time. Section 6 is a transitional provision so that the provisions of subchapter 2, 16 VSA chapter 27, subchapter 2 would take effect over a 5-year period, would allow time for the school districts to come into compliance with it. And then we get into a number of appropriations. So this one gives $1 million from the education fund to the Agency of Agriculture in FY22 for the Farm to School program in Title VI. The funding would be used to award grants during that 5-year transition period to school districts that are transitioning to making available these school breakfast and lunch to all students at no charge. And it would direct the agency to establish criteria for awarding the grant funding, which might include funding for any or all of the following capital expenditures, including equipment, staff support, administration, and training. And it requires each school district that gets a transition grant to use the funds to pay for the cost of transitioning under the subdivision and report to the Agency of Agriculture how they use the funds. Any unused funds would revert to the Farm to School program. Section 7 creates a new position in the Agency of Education, a full-time classified position specializing in administration of school food programs. It would be transferred and converted from an existing vacant position, and it appropriates $100,000 to the agency in FY22 for the salary, benefits, and operating expenses. Section 8 directs the Agency of Education to collaborate with the Agency of Agriculture to promote the local food program to supervisory unions, supervisory districts, farmers, food processors, and distributors. Section 9 appropriates $500,000 to the agency in FY22 from the general fund for local food incentive grants under that locally produced food section. From the appropriation, the agency may use up to $60,000 to hire a contractor or otherwise fund implementation costs, assist with developing and establishing the local food incentive grants. It also appropriates $500,000 to the Agency of Agriculture from the general fund in FY22 for the Farm to School and Early Childhood Grant Program. And then finally, it directs the Agency of Education to make an annual budget request for $500,000 for the local food incentive grants that were added by this act. And the act itself would take effect on July 1st.
Thank you, Ms. Carby. Sounds like an ed bill, more than an ag bill in a lot of ways. Committee, questions? Let me just kick it off then. What are we doing right now, Ms. Carby, as it relates to school lunches and breakfast? What is the status of that in the state?
So I'm happy to do the walkthrough. I'm not sure I can tell you much about, I can tell you what I understand from Jim, which is that we do free and reduced price lunch, which results in no charge to the student who's eligible for those, because either the federal funds or the state picking up the student share for the reduced price.
Yeah. No, I appreciate that. And I know Secretary French is next and will be able to answer a lot of these questions that we might have. Then any specific questions as it relates to the walkthrough itself and the language in the bill as presented by Ms. Carvey. Senator Persley, please.
Just a quick question. Is there a section by section? I know it's something we produce like when it passes out of the committee to the floor, but just as a first look through, that would be a helpful way because there's a lot going on there. So
It's a great question. I'll look in our system and check with Jim. Typically, we produce them on request. So if nobody had requested, it may not have been created yet.
Well, if there is one, it'd be good to see, but thanks.
And committee, know that Mr. Desmarais is planning on joining us, as I mentioned, at the end of the day today to start to look a little bit at S13 strike all. So we might have him for a little bit to talk about this as well. Anything then for Ms. Carvey? Yes, Senator Terenzini.
Thank you, Senator Campion. Jennifer, good to see you in the afternoon.
Yes, you do.
A couple quick questions. So this bill, if I'm understanding correctly, would call for to be funded each year from here on out with $500,000 annually, correct?
It would direct the agency to include a $500,000 request in its budget proposal and its budget request to the General Assembly. It would then be up to the legislature to decide how to fund that.
And one of those funding methods obviously is to raise taxes, right?
That is a way to create revenue to spend. Yes.
Okay. All right. I mean, I'm just trying to figure out, and I guess Secretary French probably can during his presentation, but I guess the next question of mine would be how much of this program do we expect to be funded from the feds versus having to raise taxes on Vermonters? So.
It's a great question. I don't know if the committee has requested a fiscal note on this or not, but it's something that we can learn, I'm sure, more about. Actually, I think we might be hearing more about the fiscal note tomorrow, as well as hearing more about H81. Any other questions then for Ms. Carvey before we move on to Secretary French? Jen, thanks for jumping in. I really appreciate it.
Sure. And I'm just going to hang out with my video off and listen.
Okay,
if you have more
great.
questions for me, I'll be here.
Great. Mr. Secretary, thanks for being with us this afternoon, which looks like you'll be with us quite a bit this week. You might just want to stay on Zoom in this committee. I know you've already been down the hall, if you will, into Senate Agriculture. And what we would like as much information from you as it relates to the bill, some of the things that you might agree with, your concerns, where your support or lack of support lies at this point, and a little bit about, if you don't mind, you may have heard my question to Ms. Carvey, where are we now with free breakfast and free lunch, and where will this put us? So with that, the floor is yours.
Well, good afternoon, Dan French, Secretary of Education. It's good to see you all. Appreciate the opportunity to testify. I am struck as Ms. Carvey was going through the bill and the magnitude of what's here. I'm not unfamiliar with these issues, either as a superintendent or secretary. But what's being contemplated here is pretty significant shift in policy, and there's a lot of work to do. And I know it sounds like a broken record, but my immediate reaction just listening to that summary is that I'm not sure how we're going to take this on as a major initiative in the context of everything else that's going on right now. But I'll qualify my remarks a little more specifically to a couple elements of the bill. And I think you've met our sort of exemplary food service director, Rosie Kruger, who's really, I would say, a national expert on some of these issues. And if you haven't heard from her yet, I'd suggest you might want to invite her in to come in and speak at some point. But before I go through this, I'll just answer your question directly, Senator, on where are we now. particularly relative to COVID, because we had some news actually around noon today that the U.S. Department of Agriculture is going to extend the free meals through the summer, actually through September 30th. So that's all good news. So under COVID, we've been able to operate these programs essentially nonstop since last March, and it's put tremendous strain on our system, but also its work. I would say that's been hugely successful at the local level, and everyone's so many different partners committed to feeding kids during the pandemic. So it was good to hear the U.S. Department of Agriculture has extended those waivers. I would say, in terms of the past year, it hasn't always been necessarily a positive relationship with the U.S. Department of Agriculture. It's taken a lot of work from them, no doubt, but also from our staff and the staff of other states to be very persistent and aggressive in obtaining the necessary waivers to feed kids during the pandemic. I think at one point, I want to say around August 1st, we were up to about 34 some odd distinct waiver requests of regulation in order to keep these programs operating. So it has not been easy by any means, but we certainly appreciate the extension through the summer and September 30th. It gives us a little breathing room. Specifically,
for clarification, Mr. Secretary, is that free breakfast and lunch that Department of Agriculture is doing?
That's correct.
Okay, thank you.
In terms of specific aspects of the bill, and once again, I am sort of taken back a little bit this afternoon in the scope of what's being contemplated, but I thought I would focus in a bit firstly on the local foods component and then talk more specifically about universal meals. In terms of the local foods, I am struck by how complex what's being proposed here. We've certainly support and have been quite successful, if not a national leader in terms of farm to school and so forth in Vermont. It's just what's being proposed here is exceedingly complex in terms of a grant program to administer and so forth. We think a far simpler approach would be just to appropriate additional funds on essentially a per plate basis and award those funds to districts in that regard. And we could come up with some softer ways to encourage them to spend those funds. So we would expect, the additional funds would be welcome to do that. Unfortunately, I think what's being proposed is very cumbersome from a process standpoint and would be very difficult for us to administer. And especially in considering the complexity of the regular program that we're already administering, I would seek for any opportunity to simplify what we're not doing, not to add more complexity, and albeit much of the complexity we have is inherited from the federal government. And then in terms of universal meals, I think once again, there's broad support, I think, for the concept. There's a couple really pivotal and foundational issues that we really struggle with on this. And I would say it's not just Vermont, it's a national issue. This idea of using the free and reduced lunch percentage as a proxy for poverty. And it, as you know, this is a program that's administered by the U.S. Department of Agriculture. But in education, in the U.S. Department of Education, we use that percentage for so many different things. And it's not as simple as just abandoning that percentage, unfortunately, because we are reliant on it in so many different areas. I was thinking, the conversation in the press conference today around broadband, school districts pull down significant federal dollars in the form of E-rate to support their use of broadband. And one of the percentages or factors that contributes towards their reimbursement rate is the free and reduced rate in their district. So we have to be very cautious about abandoning this percentage, as imperfect as it is, because we use it so often. So we're concerned that abandoning the rate that we have now and could cause repercussions in other areas. And I know this proposed bill directs me to solve that problem, but I can tell you it's a subject of much debate at the national level. For 6 years, when I was superintendent, I served as the Vermont representative to the National Center of Educational Statistics Forum, which ponders these kinds of issues. And the forum has produced guidance on alternate indicators that basically say there is no simple solution. So I appreciate your confidence in my ability and the ability of our agency to puzzle our way through this, but I can tell you it's not a simple issue, and it gets into tax information and so forth that is not easy to collect, or as convenient to collect anyway as what we have now. Is imperfect as it is. So I would, the funding issue is a key piece. Part of it's on how the function of the ratio currently works relative to other programs that we operate and so forth that districts really need. We do have a cost estimate in there. I know you had asked about, what are we looking at? We have a projection of 50 million to make this work. And there's the JFO might have a smaller number on that, but you could dig into that. I think some of that analysis has been done. And then, this, as I mentioned, this issue of data as a metric is problematic, and we think we really have to be cautious about just jumping into this without having that problem solved, because it's going to create significant ripple effects throughout many of our other programs. So we support the idea of universal meals. Just comment, and particularly the local foods piece, which I think we've been a national leader in. I think what's being proposed here is complex in terms of local foods. I think the universal meals, we need to answer the questions about the impact on funding for other programs and some other proxy indicator, if you will, for poverty that's been critical in our data collections. And I would be cautious about Vermont creating its own version of that without consideration of how that might impact our relationship with federal data collections. But then lastly, just as I mentioned as I started, I question the complexity of this bill and what's being asked everyone to do. If there was nothing else going on, I would say, wow, this could be the sort of flagship policy of our time. But unfortunately, we have so much in flight already pre-COVID, but certainly the COVID recovery, not to say that feeding kids isn't going to be a critical piece of that, but everything we need to do in the next 6 months to a year needs to be framed about, from my perspective, of mitigating the impact of this pandemic on the lives of kids. And that's going to take some while to unpack a little bit. So I'd be really cautious about anything, even as laudable as this effort, that might be a distraction on our capacity to support districts in that regard. And as you know, there's several other initiatives that the General Assembly is being contemplating as well. So it's, I think we need to do our best to keep a focus on the COVID relief and the recovery work as best we can. So I'll be happy to answer any other questions.
Senator Terenzini, is your hand still up, or is it up anew?
No, that's a new hand up. Thank you. Thanks for calling on me. Secretary French, you a few minutes ago mentioned a number of, did you say $50 million?
Yes, I did provide written testimony, so you can see that summarized in there, and some conversation about the analysis the JFO has done versus our own analysis. But that's a number we've worked out with some of the advocacy groups as well. It's more or less a worst case scenario, if you will.
So I hate to just ask these basic questions, but what does the $50 million get us? In other words, this bill proposes $500,000. What are you referring to with $50 million?
Well, it'd be the cost that we'd lose in revenue, and there's also going to be cost to expand the program. Right now, as I mentioned, the federal government is waiving the cost of meals essentially through the end of September. But if we were to pick up the tab for that on ourselves as a state, that's basically what we'd be looking at.
And that 50 million represents over how much time? That's not per year.
A school year, we believe.
50 million per school year.
Yes.
Okay. I just can't. I'm sorry if I sound shocked here, but it's hard to wrap my head around $50 million.
Yeah.
For lunch, breakfast and lunch for school kids.
Yeah, I mean, I would encourage you again, if you're interested in the probing this and down to that level of detail. We have a lot of staff capacity to analyze these from a policy perspective, these types of proposals, and I know our advocacy groups have as well, and the JFO has been involved. So you should, feel free to unpack those in more detail with bringing in those technical staff. I have unfortunately a superficial knowledge of most education policy issues, but you should bring those folks in for sure.
Thank you.
Thank you. Senator Perchlik.
Yeah, thank you. I just had a question on, can you remind, I know we talked about this last year, but remind me, Secretary French, on how eligibility right now for the free and reduced lunches are determined? Does each school have to do that to each child, or how's that done?
Yes, there's a certification process at the local level, and that breaks down into a couple different levels. There's this idea of direct certification, If folks are eligible for other federal assistance programs, a district would receive notice essentially that these folks, because of their eligibility for another program, are automatically qualified. And I should say this process begins at the beginning of the school year every year. Students inherit their eligibility from the prior school year through the month of September. Which is one of the reasons I think the U.S. Department of Agriculture just announced this extension through September 30th, because that's sort of the grace window, if you will. So we add the idea of direct certification. If students are eligible or families are eligible through other programs, then they're automatically eligible for this program, either free or reduced meals. And then there's an application process for everyone else. So to fill out the application, there's a couple methodologies by which a family could qualify for free and reduced meals. Either an income methodology, for example, they could produce paycheck copies or copies of their paycheck. They could bring forth other income, and there's a certification process at the local level, essentially a certification officer, generally speaking, usually the food service director. And those applications are certified at the local level, and an eligibility rate is then determined. And then periodically, our state folks go in and audit that eligibility process to ensure everyone is, that's being followed closely. But it's essentially a local process.
STEM project follow.
So, but they're following some federal guidelines about, they're making the determination if they hit that federal guideline or not, right?
That's correct. I mean, it's all prescribed. There's a certification handbook, methodology has to be implemented. And when we go in and do that audit, it's essentially to ensure that those compliance pieces are being followed. And then as part of the audit process, we also go out and sample folks in the community to make sure that, everything's been operating accordingly in terms of communication, letters to families and so forth.
And is it done on a district level or a school level?
Yeah, that's a subtle change. For the most part, under our regulation, it does reside at the school level. But then at one point, I was just saying under Act 153, we created the virtual merger provisions where we moved some things to the central office by law. Food service was not included in that. But at some point, maybe 4 years ago or so, the agency basically said, we're going to establish a food service authority at the district level. So that's sort of a recent innovation. And it sort of supports, I think, the trajectory under Act 46, where we're moving some of these functions to the district level. So I know I just gave a subtle answer to that, but where we are now, it's essentially a district level function. But there's still some underlying tension between schools and districts in terms of administration of the programs. Tension, not in a negative way, just, it's a complex program to run.
Senator Hooker.
So, thank you, and thank you, Secretary Franklin. Can you just elaborate on the impact that the Universal School Meals Program would have on the funding based on poverty? Can you just explain to me what would go on if this program were to be in place? I mean, wouldn't we still have you've talked about other ways of certifying that people are meeting the eligibility of the requirements, but what would happen if this program goes in place, and why would that change things dramatically?
Yeah, I think, it's problematic on a couple levels. Essentially through, as I just described, sort of that certification process, a district's rate of free and reduced is established. And then that rate is used as a proxy measure of poverty in many other areas. The example I mentioned, E-rate, for example, or title grants. We rely on that percentage of eligibility for so many different aspects of federal education funding in this country. And so anytime we move away from this has sort of been the national conversation. How do we abandon essentially what is a very convenient measure, although a very imperfect one, when so many of our programs are dependent on it to determine poverty in communities? So no, from my perspective, this is a national issue that's being debated between the U.S. Department of Agriculture and the U.S. Department of Education. There has been no simple solution coming down from the federal government on how to do this. So my point is, because it's not as simple as just Vermont doing it itself. There are implications both from a financial perspective and a data perspective that need to be contemplated. And it's really been the chief stumbling block for us to move beyond just our advocacy for feeding kids in a universal way to actually figuring out a way to enact it, because it puts other things in jeopardy that are pretty significant.
Okay.
So essentially, we would not have a rate of participation. And when it comes time for districts to apply for other things that require that rate, I'm not sure how we would respond.
Okay, because everybody's eligible.
Yeah, essentially everyone's eligible. There is no application process at that point if it's universal. And what's in our written guidance, some of the analysis we've sort of looked at is, okay, so what's the motivation? We could contemplate some other application process to determine a rate, if you will. But what's the motivation for people to complete that if they're automatically going to be eligible? It's why would I complete this paperwork and disclose my income, for example, when I know I'm already going to be eligible under a universal program? So that's the challenging piece that we haven't been able to figure out.
To get money for other programs, I guess.
Yeah.
That would be the reason. Right?
Yeah, it's unfortunate. Again, I've been at some of these conversations at the national level, and it's as I mentioned, we've had to apply for so many waivers this year. The U.S. Department of Agriculture administers these programs. These programs were established out of a very specific historic trajectory out of agriculture, and we've become dependent on them to a large extent, statistically and otherwise, in the education policy area. But my impression at the national level is they don't necessarily talk to each other, and we get caught sort of in between. And I think, again, Vermont's been a leader on many of these issues, and even as a leader, we find ourselves often in conflict with the policy and regulation, and have to really be on the cutting edge of pushing those barriers to get what we need to happen for kids.
Thank you.
Mr. Secretary, I'm wondering if this bill were not to go forward this year, what could we do, given the federal dollars coming in, to make certain that, let's say, it's pushed out a year, 2022? What are some of the things that, is it possible for us to still provide universal school meals from end of September through the academic year, given some of the federal dollars coming in?
Yeah, I mean, I can lay out some scenarios for that, and particularly talking about what we call ESSER funds, the elementary, secondary education relief, emergency relief funds, which, districts, firstly under ESSER, districts have the authority over 90% of that funding. So they direct a lot of how that money gets spent. So the first thing would be, we would need to encourage essentially districts to attend to this type of program. And to the extent this type of program would be permissible as a COVID use, that rationale would have to be developed. So to what extent could districts spend the money they're going to receive under ESSER on universal meals? They will need to be able to make the connection between universal meals and COVID, which can be done, I think, fairly easily per se, but it's something that still would need to be developed. But the point is, the districts control that funding. It's considerable funding, but they're also going to have other priorities. They're going to have priorities like mental health and so forth, which is why in our recovery work, we want them to go through a prioritization process. Yeah. But conceivably, they would have funding to address some of these issues, and I don't know what that would look like at the local level. But my guess would be, based on my own experience, that they would seek to put money into things that have been working pretty well. And we have very strong partnerships on farm to school at the local level. A lot of partnerships with local producers and so forth. I think they would seek to, keep building those structures out with these dollars. But on the other hand, these are one-time funds, so it's hard to say at this point. But ESSER, that's an example of how ESSER could be utilized.
Okay. Senator Persley.
Yeah, and maybe my question, are we hearing from Senator Pearson, or is he just stalking us in our committee?
We are hearing from Senator Pearson, but given schedules, okay, we're hearing from Secretary French first.
Okay, because I think some of my questions are kind of like what are probably better for the committee that created the bill than for French. But maybe one question that the Secretary does have is, do we know what the current rate is of those that are eligible for the current reduced meals take it up? Like for other programs, we usually have a ratio, like we know how many people are using the program that they could qualify for it. Do we have that data, or do you know?
You're asking what are the eligibility rates currently for the program?
Like percentage wise. So if we knew there was 100 kids that were eligible, but only 90 signed up to get it, that we'd have a 90% take up rate kind of thing.
Yeah, I mean, I guess the only indicator we would have is what we have now for free and reduced, and certainly, again, I think my program staff could come in and speak to you about. You're asking basically what would happen if this was opened up, and what would be the motivation of people? To what extent are the current processes a barrier?
Well, I'm not asking that. I'm just wondering the current program, how successful it is reaching the people that need it. Like, are there some people that need it or eligible but don't sign up for it? Like that happens with other programs.
Yeah, I think there's definitely some of that, and I think it varies from community to community, so it's hard for me to make a general statement about it. I think there's, I think you're probably familiar with the community eligibility. There is a process by which a district can sort of determine that everyone in the district is eligible without, individually having that certification process go forward. So there are communities that are able to operate that way, and they could certainly provide you some testimony on how that's working. But I would just, I do want to reinforce, I think, sort of my new aha today, that what's being proposed is exceedingly complex at this given moment. It's not so much just looking at it on paper and reading through it. I think we have to think about what's being contemplated relative to the COVID moment that we're in. And there's going to be a lot of changes in education policy. I don't think we fully contemplate, both from the federal government and at the state level, as a result of COVID. So I'm kind of being cautious, and I don't think overly cautious, about thinking about our capacity to take on a major initiative, a complex major initiative, simultaneously with just really being focused on what the impact of the emergency has been on our kids, and being able to support districts and being responsive to those very specific needs in their communities.
Thank you. And I believe, Secretary French, we have to leave it there with you. I believe you have another commitment, but we certainly appreciate your time. I know we'll be seeing you tomorrow, probably Thursday and Friday and Saturday and Sunday. And
happy to help anytime.
No, we really appreciate it. Thank you.
Take care.
Yeah. Senator Pearson, thanks for joining us. You've been here for the conversation, which is great. Why don't you start by telling us the genesis? Are you the bill sponsor, or is it a committee bill?
It's a committee bill, and it picks up on a bill that was, I think, also a committee bill last year around the local food incentive that, was underway just as we all had to go home. So got left on the drawing board.
Great. Why don't you've heard a lot of the concerns.
Sure. I'd be glad to try to help you.
That'd be great.
For the record, Senator Pearson from the Chittenden District, and one of the reporters of this bill, which passed out at Committee 5-0. The Secretary talked about the COVID moment, and I think that is a very useful frame as we approached our work, which sort of started more focused on the local food piece of this, which you might expect out of the Ag Committee. We have seen all of our schools, as the Secretary just reaffirmed, delivering universal meals. That has been a shining light as an example, something we can be proud of. Our folks at the district levels have worked incredibly hard. We've heard stories of teachers driving and delivering meals. It's been something that, to my mind, has been very exciting, and something that really reflects well on the community of Vermont. We have been delivering throughout the pandemic, and as I just learned, we'll go through September with a universal meals program in our schools. And that's really important because on a given pre-pandemic, we had food insecurity rates in Vermont of about 1 out of 10 people. And data coming out of UVM is that the current rates of food insecurity is 1 out of 3 or 1 out of 4 people in Vermont.
And just for clarification, you're talking about school-age children.
I'm talking about people in Vermont that report as being food insecure.
You have those numbers K through 12?
I don't believe we have that data. The UVM has been in an ongoing way measuring this, and I encourage you to talk to people from Hunger Free Vermont. So, you know, I think about that. 1 out of 4 Vermonters expressing food insecurity. That doesn't go away a month after the emergency order is lifted. And certainly in our caucus, we have spent a lot of time agreeing that we wish to see if we can address food insecurity. So then I'll just first take the local incentives piece of this bill, even though it's second, if that makes sense. What we did there was, it's interesting, the secretary wanted it to be more simple. We tried to simplify it. Rosie, out of his shop, asked for it to remain in the structure that we had here, and it was actually the structure we worked on building last year with her, because it better reflects the current status in our schools. Okay, schools are already got a designated food sort of overseer. They already define local foods, which is why we don't transition until after the first year. There's already, as Secretary said, successful farm to school programs. Those have been basically, in my mind, driven ad hoc by school, you know, maybe parents approach the school board decides to do it, or food director decides to take it on, and then the state has good grants that come in and support them. It's time to take that to the next level. It's time to not be dependent on, hey, we've got a great lunch director and they're willing to do this, and to really standardize it. So we started looking around the country. Michigan, New York, Oregon, all have something akin to this local incentives. And in New York, the data is off the charts how well it's working. Every dollar you put into local food, you're getting about $1.60 back in reverberating around the economy. In New York, what they're seeing, they peg their percentages higher than we're contemplating here. You have to hit 30% of your food to be local in order to get a 30-cent increase. They're seeing some schools be up over 60% local foods. They are seeing markets being created because they have used this program now for 2-3 years, and it's dependable, reliable, and consistent. And so businesses are stepping in. That to me is very exciting when we try to stimulate the local ag economy. So we're building there off of successful programs, not overly cumbersome. They're road tested, even just across the lake in New York State, being done there. We phase this in so that schools can get up to speed, but some schools that are in already doing it, many of our schools will be over 20% local already. They can go a little faster, but so you'll see the tiers in there. We didn't want, because of this gets trued up at the end of the school year. So if a school, for instance, in New York, they said, if you're hitting 30% local, we'll give you 30 cents a meal. At the end of the year, if they come in at 29%, they don't get anything. And that didn't seem fair to us. And working with Rosie and other advocates in the farm to school world, we like the idea that there would be a catch-all. Well, we're aiming for 25%, and therefore 25 cents a meal, but we only got 24%. So we'll still honor that you're buying more local than you were last year, and we give you a 20-cent per plate incentive. So we like that. It's based on successful programs elsewhere. It's smart for our economy, and it's building on something that works. But it's the local food structure has not been. It's not got a system. It's not systemized in that sense. I talked to a principal in Essex who buys maple syrup on his way into school, puts it in the trunk of his car. That's not what we're talking about, right? We need to move beyond that. So this is an attempt to do that. When we dug into it, we were learning, of course, about the current status of universal meals being across the board right now, and wondered if we could continue that. And I was interested to hear the secretary did not mention, we have 70 schools today, and in many cases for decades, that are delivering universal meals. So it's not some unimaginable bureaucratic process. We already have it in 20+% of our schools. We have Universal Meal Program in New York City. So the millions of people that live in New York City have found a way through this paperwork challenge that the secretary seems to say is insurmountable. I believe they just collect household income. And there's no way New York City is leaving behind federal dollars in order to feed everybody in New York City in their school program. So the bureaucratic challenge, I'm not saying the secretary is just totally wrong. We've heard very consistently that this is a challenge, but it's being solved in New York City. It's being solved already in 70 of our schools, and my own school district here in Burlington for 20 years now. They've had universal meals. So there is some ability to get there. You heard the secretary say that their estimate is $50 million. That is based on, according to their testimony, if every kid in the state, in every school district, took every meal they could. But it ignores the fact that we phase this in over a number of years. And it ignores the very data that's coming out of the 70+ schools in Vermont today that have universal meals. So when you extrapolate what's been happening in the schools where we have universal meals, your estimate is closer to $20 million. Now, $20 million is nothing to sneeze at. But again, this is over up to 5 years. And $20 million out of a budget of $1.5 billion of we pay for schools, I think needs to be in the context of what other strategy do we have to deal with the 1 out of 4 Vermonters expressing food insecurity. So we have consistently heard from the Agency of Ed that they support this goal and that they have concerns. We heard that last year when we started our conversation about the local foods. We've done more work, admittedly, on the local food incentive, directly working with all of the people, and there is a state infrastructure to help with that between the Agency of Ag and the Agency of Ed. We heard consistently since last year, and then more as we dug into the details of a universal meals program from the agency, that they support this goal. They did not come up with any alternatives for us. And that was a really tricky part, because we're very open to working with them, making it as simple as possible. We want this to work. And yet, for some reason, they're not able to come forward with solutions. We've been delivering meals to our kids today. When the pandemic ends, the hunger and food insecurity is not going to end. And I would be proud of us leading this charge and saying, you know what, we're going to feed our kids. It's pennies on the dollar it's fractions of a penny on our education dollar. And it just takes care of a basic need. And we're trying to say, let's do that in a way that also stimulates our rural economy, gets our local food into our local schools. And I should say, by the way, the farm to school program that we have is the envy of the world. It's time to take it to the next level of the country, maybe not the world. It's the envy of the country. And up the hill for me at UVM, one of their food contractor is Sodexo. Now, Sodexo took a lot of heat in the last decade about their desire to have local food and whether or not they were doing enough to stimulate local ag. At UVM, they buy 20% of their food locally. This has a huge impact on our economy. And what they'll tell you anecdotally is the reason that program is still continuing is the Vermont kids that came through schools where they had a strong farm to school program, and they look around the cafeteria up at UVM and want to seek out the local food. And the farm to school program is just some of the greatest testimony I've heard in my entire time in the legislature, because it's not just getting the local produce in the salad bar. It's often gardening. It's using math as your gardening. It's hosting parents for a community night to eat, including eating the food that they've grown, baking bread and serving it to their parents. There's just tons going on here that's well beyond just the farmer down the road gets to bring you his carrots. There's really, really positive things, and I think it's time we build on that. I'm not oblivious to the challenges, fiscal or otherwise, but I hope we can advance this and punt it to the folks in appropriations to see if they can come up with the money.
Right, great. Thank you. Questions for Senator Pearson? Senator Hooker, please.
Thank you. Senator Pearson, the secretary said $50 million a year. You're saying $20 million over 5 years.
No, I'm saying no. $50 million assumes every school has it and every kid takes it. Mm-hmm. We have 70 schools that have had this in many cases for decades, and 100% of those kids don't take this. So I'm saying that it's just silly to extrapolate from 70 to all 280 of our schools and assume that you ramp up participation. So when you take and you extrapolate their experience, the budget total is in the neighborhood of 24 million, and I believe Joint Fiscal is trying to tune that number up, but it's in the 20s. Also, our bill doesn't contemplate universal meals next year. I'd be open to that, but it doesn't. It phases it in over 5 years, recognizing that not everyone's going to be able to do it in 1 year. So it's not 50 million, it's closer to 24. It's not 24 in year 1. If you get there by year 5, then you're probably looking at something like $24 million.
Thank you.
A year.
Yeah. Senator Terenzini.
Thank you, Senator Campion, and Senator Pearson, thank you for your information. I love the idea of the buying local, supporting our local farmers and growers. It's a great concept. I want no child to go hungry, in our schools. But so we fall somewhere between 20 million and 50 million a year out of 1.5 billion. You're right; it doesn't sound like that much, but I still get hung up on the fact that we're probably not going to cut another program to offset the cost of this. So we're going to have to increase the overall budget, in my mind, by 20 or 25 or $30 million to support this program annually. And again, coming out of COVID, hopefully soon, with restaurants and bars and so many industries just devastated over the last year, I don't know how I can go back to my constituents and say, I just voted to support something that's going to possibly raise taxes by 20 or $30 million a year. And that's the sticking point for me. So that's where I'm at. I appreciate your testimony. It's a good concept. I just don't know how we can afford it.
I guess I would offer that, as we've seen in the last year, I sit on Senate Finance. A year ago, we were told that the Ed Fund had a deficit of $150 million. Now the Ed Fund is running a surplus. Turns out people like ordering from Amazon during a pandemic when they're locked at home. So the sales tax is outperforming any estimate that we've had. So I don't, it's just not as simple as saying, pass this bill, increase taxes. Pass this bill, there could be an increased cost, yes, but it does not translate to an automatic tax increase, far from it. The other reality is, there's an efficiency of feeding kids in a more holistic way, right? I mean, now they're not bringing lunches, so you're not inventing new costs. You're maybe shifting around how it gets delivered.
Final question for Senator Pearson, knowing that we have witnesses, and I do want to give colleagues a break. I know we've been here almost 2 hours. All right, I think we'll leave it there. Senator Pearson, thanks for coming in. Very helpful. To our witnesses who are here to continue the conversation on H81, if you wouldn't mind, we are going to just take a break until 3:30. Senators have not had an opportunity to do so. So we will see you all at 3:30, and then we will be with you, I think, just about until about 4:30, when we will continue our work pick up our work on S13. Welcome back to Senate Education. It is Tuesday, March 9th, 3:31 in the afternoon. We are going to continue with our return to our work on H81. Before we do that, Senators, we will probably have a little more testimony on S100, but I certainly will be looking tomorrow for your guidance with regard to what direction you would like to move in. There are different ways we can take a look at this. We can certainly send it out with the approval of the committee. We can send it out without recommendation. In other words, we want to advance it along the process, but we don't have enough time to really dig into the work, but certainly don't want to hold it up. And then we could always, we could vote it out with a negative recommendation. And of course, it can be amended. So for new senators, know that there are a range of possibilities there. I have to say, my instincts, when a committee sends us a bill and has done a lot of work on it, is to help to, at the very least, to advance it to the next stage. Doesn't mean it can't leave our committee in some ways with amendments, and certainly as you're reviewing the bill, feel free to propose those. But we will have to make a decision by the end of the week because this will go to appropriations. Senator Lyons, please.
We've been working on this farm to school for so long. The first year I was in the Senate, we worked on it. It is an important concept, but did anyone ask about whether or not we could simply ask for a certain percentage of all food spending for schools to be farm to plate, fresh foods, fresh network? And I know that it's more than that. I know it's covering all the kids, but we also, the concerns that I've heard from some of the schools in my district is that there are kids who just don't need to have that support. And that money could best be used by another district and another set of kids who have those needs. So I don't know how we resolve some of those issues. Anyway.
Yeah, no, it's a good point.
Yeah.
And we'll continue this conversation later in the week. With that, we will now return to H81. Ms. Soares, you were probably in mid-sentence, so I apologize. But if you don't mind picking up where you left off, we'll then return with Mr. Salzgiver, Mr. McNeil, Neil O'Dell, and then Jeff Fannin. So knowing that we have less than an hour, I'm going to have to move us along. So with that, please, the floor is yours.
Thank you. So I believe I concluded talking about generally the health plans being more generous now, people paying less in premium and out of pocket in 2021 than they would have been paying for 20% premium of the 2017 plan if you had adjusted that premium 6 1/3% every year for medical trend. And when you have such generous HRAs, having the same out-of-pocket cost share for employees at all levels of position, I think is reasonable and aligns with Act 11's goal, which was to have the same premium and out-of-pocket cost share, and the fact that we now have the same access to health coverage for all employees. The second thing I wanted to talk about, which I know was a topic a little bit when the bill was introduced, was actuarial value. So I think we all learned about actuarial value, or at least I did, in 2014 when Vermont Health Connect came online. And the AV, actuarial value, allows us to compare health plans rather quickly to determine whether a plan has higher premium, which means lower out-of-pocket costs, or lower premium, which means higher out-of-pocket cost. The platinum plans on the exchange have an AV of 90%. So that gives us some information about how to quickly compare with a bronze plan that has an AV of 60%. The VI plan that closed in 2017 that I just talked about had a 95% AV. When you add an HRA to a health plan, you actually increase the AV of the health plan because you're shifting costs away from the employee, which is what AV is based upon, what the out-of-pocket costs are for the employee. You're shifting those costs to the employer with the HRA. So when you do that, you're changing the AV of the health plan. The more dollars you put in an HRA, the greater the AV of the health plan. And this is a dynamic that actuaries take into account when they price health plans. The current AV of the health plans in 2018 with the HRA, and I showed you that visually on the slide before a little while ago, is 98% for unlicensed employees and 97.5% for licensed employees. I'm not aware of any plan available to any other Vermonters that has a higher AV. So AV is an important benchmark. VHI has to take the HRA and the AV into account when it sets its premium rates, because as I said, when you have a higher AV plan, you have a higher premium. And if VHI did not adjust for the HRA, VHI would have a loss, and that loss would mean that VHI needs to increase premiums the next year, both to collect money that it lost the first year, plus increase to make sure the next year they don't lose money again. And in fact, half of the increases to VHI's premiums, they've had double-digit increases for 4 years, or close to half of it, has been this trying to catch up with the HRA value. So because it's important to VHI to know that, the Blue Cross actuaries are already calculating the AV of the health plans with the HRAs. That's how I know the 98.1% and the 97.5%, because it is in the public record if you attend VHI board meetings or watch them online or look at the materials that get sent out by VHI. So the base information about the actuarial value is already calculated by Blue Cross because VHI needs to know it to set their premium rates. So the request to add language to H81 to have the AV value included and known by both parties is really about the incremental change in AV up or down that either side would propose. And I think it's important for both sides to realize that when you're saying we should have an HRA that does this, it goes up or it goes down or whatever you want to talk about as you talk back and forth, you understand how that is going to impact future premium increases. And so what we're looking at is really the incremental difference. And the employer commissioners has asked VHI and Blue Cross to provide us with the formula they use so that we could simply say, what if the HRA was worth $200 less or $200 more? How would that change? So we don't think it's a significant burden. In fact, we think it's critical because right now in law, in Act 11, the arbitrator or arbitrators must consider the comparable benefit being proposed by each side to Vermonters. What are comparable plans available to other Vermonters? And AV is a benchmark to allow that to happen. It's the benchmark that we use in Vermont Health Connect, and it's an acceptable benchmark. So I think that's reasonable, and it won't be cost prohibitive because it doesn't require a full actuarial analysis.
Okay, and I'm going to ask you for your concluding comments soon, only because we are tight on time.
Yep.
Thank you.
So I have spoken to this, but I wanted to just emphasize it, that the decisions the commission makes around the value of the HRA does impact premium. As I said, nearly half of VHI's premium increases have been a result of trying to catch up to these rich HRAs that are more generous than anyone anticipated. And we can control healthcare costs through how we bargain around them. Now, I know most of healthcare costs are driven by things outside of our control, and that's why we have the Green Mountain Care Board and One Care Vermont and all the work we've been doing. I understand specialty drugs are driving healthcare costs and the fee-for-service model. So those are things that we can't control. But We have 34,000 covered lives in these plans that we're talking about. And small decisions by a lot of people can add up. If half of those 34,000 lives could change a behavior that saved $100 in a year, that's $2 million in premium. And $2.5 million in premium can save or $2.5 million can save 1% off of a premium increase the next year. So how can you make those changes? You can make sure that x-rays aren't being duplicated. You can make sure you have a generic medication. In fact, VHI just put out a flyer about that. So there are lots of ways that we can individually help bring down costs that we don't do if we have an HRA that covers all or most of our costs, or that covers so much of our costs before we pay anything that we aren't sensitive to costs. If I go to the pharmacy and I pay nothing because
Ms. Orris, with all due respect, this is not the healthcare committee. I mean, we know the ins and outs of this, and it's tight. So let's stick to the bill and what we're trying to do.
But what it shows is that having information for the arbitrator will impact future costs, which is an education policy issue. And my very last comment, and I will just say that it's in my written testimony, is that Representative Waltz indicated that the premium was going up 11% this year, and one of our most popular plan going up 18%. Actually, the most popular plan is going up 9.6%, and overall premiums are going up 9.8%. So I wanted to make sure that that was in the record, and I open up to any comments or questions. Thank you.
Thank you. Questions for Ms. Soares? Mr. Salzgiver.
Okay, thank you, Chairperson Campion and members of the committee for the opportunity to testify today. My name is Jim Salzgiver. I'm chair of the Bennington-Rutland Supervisory Union and a member of the Taconic and Green Regional School District Board. The BRSU is responsible for educating about 2,200 students in southwestern Vermont. I believe you all should have received my written testimony. And what I'm trying to do is provide a little bit of sort of general background for you guys, thinking that would be helpful to your deliberations. So for many years before Act 11, like other school districts in Vermont, at the BRSU, we negotiated with our school employees every several years to come to an agreement on healthcare benefits, salaries, and working conditions. Some school districts in Vermont probably take a confrontational approach to negotiations. I expect that would be a real minority of districts. And at the BRSU, we've instead worked hard, as have our employees, to build a positive relationship for negotiations. With that relationship building, our school employees have built confidence that we value them, we care about them, and we always want to be fair with them. But they also know that we represent many other stakeholders beyond our employees. We also represent our students and families, our community members, and the taxpayers in our communities. And our employees know that every year, our school board, one of its biggest jobs is to balance those obligations to all those different constituencies and put a budget together and present it for approval by our voters. Employee costs are a big issue, as they're roughly 80% of our operating costs. But our employees know that we have a genuine interest in looking out for their best interests while also presenting a budget that our communities will support. That positive relationship has been instrumental in allowing us to navigate some major changes before Act 11 in negotiations in recent years. First, with Act 153, Act 154, and later Act 46, we shifted from district by district negotiations to negotiating at the supervisory union level. That was a big change. We had to harmonize employment terms across multiple districts, and they were very different from one another. It wasn't easy, but our good and solid relations with our school employees allowed us to make the change successfully while maintaining that positive relationship. Then came an even bigger change with the Affordable Care Act. The ACA did away with the health care plans, as Laura had mentioned, that we provided to most of our employees. The ACA shifted everyone away from plans where the beneficiaries had a very low cost share. And the rationale was pretty clear: to bend the healthcare cost curve by incentivizing users of healthcare to be more cost conscious. But it was still a heavy lift in negotiations, and it was a real test of our employee-employer relationship. And, you know, honestly, like everyone else in Vermont, teachers are not all that fond of change. But it was clear that change was going to have to happen. And as school boards and employers, we recognized the need to mitigate the burden of the cost shift that the new plans would put on our school employees. Luckily, we had some very smart, and we have some very smart and talented people at the BRSU business office, and they helped us understand that this change was actually an opportunity for us, that we could produce a win-win outcome. We could combine the new health plans and health savings accounts to give our employees a very fair replacement for their old healthcare benefits that they could view as a win for them, while our districts and school budgets could also achieve a degree of cost savings, so a win-win on each side. It was a tough negotiation, and we needed to make some adjustments along the way in negotiations, but ultimately we concluded one of our most challenging negotiations ever with the holy grail of negotiations, an outcome that both parties considered a win-win. So then we had, with that experience under our belt, the idea of statewide healthcare negotiations come up. And a lot of us as school board members felt hopeful that that could actually lead to a win-win on a statewide basis, which would be great for students, great for school employees around the state. And in our district, we knew that we had proven that a win-win outcome could be achieved. We also took comfort in the intent language in Act 11 that stated, it is the intent to transition to a more equitable healthcare coverage statewide in a manner that is fair and practicable for all parties involved. So that gave us some comfort. We also had at that time a recent and more tangible expression of what the legislature was thinking, what the legislature was thinking, and that you guys felt that a win-win was possible, and not only possible but expected. That was, as was mentioned earlier, Act 85 of 2017 was a response to the ACA. And in that legislation, basically what it meant, all Vermont school districts were actually charged in their budget years of 2018 and 2019 for the healthcare recapture, which was to return the savings that it was assumed that we would make and return those savings through healthcare negotiations and return those to the Ed Fund. So that seemed like a pretty clear indication of legislative intent and an expectation of a win-win outcome at the statewide level. So many board members like myself were hopeful that statewide negotiations would achieve a win-win at the statewide level. Now, the first round of statewide school employee healthcare negotiations, frankly, seriously deflated those hopes of many school board members like myself. The two biggest takeaways from those negotiations were, one, there was no win-win financial outcome. And at the BRSU, we actually lost our earlier win-win with respect to the ACA. That went away. And the second key takeaway was the arbitration process did not work well. To give you on that win-win, to give you an idea of just at the district level, the impact on finances. I mean, healthcare cost pressures on school budgets aren't new, but this negotiation ramped up the pressure in our current budgets and also our concern about future budgets. At the BRSU over the past several years, health benefit costs have been growing roughly twice as fast as our overall operating budget, and that's with a stable number of employees. And in just a few years, health benefit costs in the BRSU have grown from 14.8% of our total operating costs to 16.3% of our total operating costs. And, as Bridget had mentioned, that led us to find other areas to cut. Now, we're also concerned because in future years, we're exposed to some potential even bigger hits. That exposure comes from a good news, bad news sort of story. With this agreement, as has been mentioned, higher level and higher cost health plans were made available to more of our lower paid employees. The good news is we're happy to have those employees having expanded access to healthcare. But the potential bad news is that our future budgets could really be hit hard. Not that many of those employees switch to higher level plans this year, but every one of them has the right to do so in future years. To put that in context, an average lower paid employee at the BRSU earns about $17 an hour, which is a bit more than $23,000 a year. If that employee chooses a family plan for health insurance, the cost of the BRSU is a bit more than $28,500 a year. And that's actually for a non-licensed employee, it's about $2,600 higher than for a licensed employee. So as I noted, not a lot of people made the shift in year one, but everyone has that right. And so that's a big cost exposure that we're facing going forward. Another financial concern is the one, as Laura Soares had mentioned, the nature of the plans has really put pressure on healthcare premiums. And that's a cost that's borne by both the employee and the employer. But the big point today is really the second takeaway, that the arbitration process didn't work well. And I would suggest is desperately in need of some fixes. As I suggested with our negotiation experience at BRSU, the best and fairest outcome to a negotiation will almost always be one where the parties reach an agreement on their own. If a meeting of the minds between the parties can't be reached, then your backup, arbitration, needs to be a clear and a fair process. Any weakness in the arbitration process will lead to a subpar arbitration outcome. From the start, this negotiation process did not appear destined for a meeting of the minds between the parties. And that's, really unfortunate. In a perfect world, one would hope that we could get to the point where arbitration wouldn't be necessary. But I just can't see that happening anytime very soon. So again, if we're relying on arbitration, the arbitration process needs to be very clear and as fair as possible to achieve the best outcome for everyone. And so what needs to be considered in arbitration? It's really the impacts on each party, and those I would just shorthand for employees. It's the quality of benefits provided to those employees and the cost of benefits to those employees. On the employer side, and for the stakeholders that we represent, it's also the quality of the benefits provided to employees, but it's the cost of those benefits to the employers. So a fair arbitration process really needs to consider both of those impacts to the employee and the employer side. And honestly, when the arbitration process is the last best offer process, as this one is, it's even more important that the arbitration process is truly clear and fair. If an arbitrator could choose elements from each party's offer, then it would be a lot less important. But in a last best offer arbitration, if the process is skewed, then one party won't feel the pressure to truly provide a best offer in their last best offer. And honestly, one should also expect that their focus would shift to managing the arbitration decision from the presentation of their last best offer. The current law, based on Act 11, did, as it's been brought up, suggest that arbitration should be considering the impact on both parties. In my written testimony, I actually lay out the 5 factors that are to be considered by the arbitrator, and they do include things like the financial ability of the ed fund and school districts to pay the costs. It also includes a comparison of benefits of school employees with benefits of similar employees in the public and private sectors in Vermont. But just an observation, it appears that that provision of the law was underappreciated or somewhat overlooked in the first round. Unfortunately, we can't really know that because, also as has been pointed out, the arbitrator's decision didn't provide any rationale for the decision. I also understand it, I don't know whether this is accurate or not, but that some employee commissioners may have argued during the process that the cost to school districts shouldn't be a factor to be considered by the arbitrator. So basically, where I come out on this is it really wasn't clear what the arbitrator was considering, and his decision gave us no clues. And it would seem also as if there might have been some disagreement amongst the parties to the negotiation as to what needed to be considered in the arbitration process. So that brings us to H81.
Yes, and you're going to have to be very brief, Mr. Salzgiver.
Yeah, okay.
I did tell Ms. Siglowski, really, we're looking at brief testimony given the incredible amount of work that this committee has between Fridays.
Apologies. Okay. So, basically, I'll get down to in my written testimony, I laid out the couple of items from the House General had looked at H81 next to H63. H63 had provisions that I believe are important to ensure that the arbitration process is clear and is fair. That's really what they're trying to get to. But at the same time, so you can find those in several different places. Basically, though, I want to leave you with, it's important for you guys to understand that school boards are actually on the side of employees. They're one of the constituencies that we serve. So every school board member that I know has the greatest respect for school employees, a real interest in making sure they get a fair deal. We can't do our job if we don't maintain a high quality and motivated staff in our schools. But we also represent other constituencies, and that's why it is so important to us that that this arbitration process be a totally fair process, get the kind of outcome we're looking for, which is hopefully a win-win for employees and employers around the state, and also having the added benefit of making some progress on bending the healthcare cost curve. So that's thank you for your time and attention.
Questions for Mr. Salzgiver? Mr. McNeil and Mr. Odell, new information, things that we have not heard. I think we have Mr. McNeil up first.
Thank you very much, Mr. Chairman. And my primary role before your committee is just to be a resource. I was the chief negotiator for the employer side of the healthcare negotiations, and so have a fair bit of knowledge as to what happened and what didn't happen that I won't dwell on now. What I wanted to call to your attention today was what I believe to be a unintended but technical flaw in the bill as it came over from the House side. And I am referring specifically to pages 8 and 9 of the bill. I'll just set up the situation. As we were debating on the House side, the employer commissioners wanted to switch the arbitration methodology from private arbitrators to the Vermont Labor Relations Board. The employee side of the ledger did not want to do that. They wanted to keep to the AAA or to private arbitration. In conversations with the chair of the House General Committee, Representative Stevens, we both indicated that we could live with the notion of having the VLRB as an option available to the parties if they both selected it, but otherwise the panel would be the adjudicator. That sets up what I believe is a technical problem with section 2104 3B 2. And if I could just frame it, it says that if the commission is unable to agree on an arbitrator, it shall request the Vermont Labor Relations Board to decide matters remaining in dispute or form a 3-member panel of arbitrators to be selected as outlined. What it doesn't say, because it uses the word or, it doesn't say which is the default. which body is utilized if the parties cannot agree. The understanding was that if we couldn't agree, it would be the panel. And I suggested in written testimony that I submitted today some language that I thought would fix that. I did run it by Vermont NEA. They take a different view than me, respectfully, as to whether this needs to be fixed. But I'd call it to your attention. We would suggest that it would be better to be fixed. And so hopefully I've followed the Doyle methodology and outlined the problem and the hopeful solution to it.
Terrific. Please note, Mr. McNeil receives an A. Terrific. Questions for Mr. McNeil before we go on with Mr. Odell? Senator Terenzini.
No, not at this time. Thank you, Senator. I was just fixing my screen.
All right, all right. Senator Chittenden.
I'll try to be brief because I know, Chair, we have a lot to do. But going back to Mr. Salzgar's testimony, it seems to me that the last arbitration didn't result in a clear enough decision. What I am seeing in H81 is some new language that is stating clearly a written decision with clarity as to where they came from. So I hope that that would mitigate it. And I also am hopeful that the current language of Act 11 already does speak to many of the cost considerations that I'm not necessarily seeing as necessary if we get a clear rationale from the arbitration process with the new language in H81. So I'm wondering how much of this was just a bad experience with that arbitration where we didn't get clarity as to what they were thinking and how much it's already being rectified. And in my mind, I'm trying to evaluate the need for this additional high bar of cost quantification when Act 11 does have pretty consistent considerations. Do you have any reaction to your concern raised about the new language requiring a written, detailed summarization of the arbitration's final result?
If I could take that, I'm sorry, Jim, did you want to take it?
Nope, that's fine. Go ahead, Joe.
I would say you're correct, Senator Chittenden. The language that is in 81 now is definitely an improvement. What we don't think it does is go far enough because we don't think it recites the need for the basic balancing between access and cost containment, to put a fine point on it. And we think that if you look at the continuum from Act 85 to Act 11 to H81, that's the missing ingredient. I could be more detailed, but try to.
Thank you.
Okay, thank you. Mr. Odell.
Thank you, Chair Campion and committee members. I know you're pressed for time this afternoon, so I will be brief. You have my written testimony, submitted it earlier today through Jeannie, so you've got that. Three things. One is we do think that you should call for a fiscal note, and I believe Senator Campion, you actually mentioned earlier today that you were going to do that. So we think that that would be, key. And then the two items that Joe just addressed were just we think that there should be some additional guardrails around the arbitration process, and those particulars are laid out in my testimony. I'm not going to read what I provided you guys today. I'll just be brief and say, like you all, school board members are elected public officials, and every year we're tasked with the job of developing a budget. And those budgets sort of need to weigh the cost of providing the education for the kids versus our community's ability to pay for those things. And there are trade-offs involved. And so when a piece of legislation like this comes up and we see the potential that it has to add to the education fund, and thus our local budgets, we come to you and raise those issues with you and hope that they're considered. We're just looking for some additional balance in the process here. But with that, I'll cede the rest of the time, and certainly if you guys have any questions, I'm more than happy to answer them.
Committee. Questions? lot there from all of you. Thank you. Informative, without a doubt. We may have some of you back or have your representative, Sue Siglowski, back, depending on how we move this week. But just want to thank you all for taking the time and appreciate the testimony. Seeing no questions, Mr. Fannin, who I think might be introduced as saying, talking about perhaps has a different position in some regards. I may be inaccurate in that, but appreciate you being here. Thank you. And again, the floor is yours.
All right. Thank you, Senator Campion, and thank you, committee. Just so I'm clear, what time are you out of here?
Sure. No, thank you. I appreciate that very much. Chairs has been pushed back today to 5, so we do have a little time, but we do have to have a walkthrough of the weighting, the new version of the weighting study, which I am told may only take 15 minutes. So why don't we say we've given folks about an hour and a half, I'd say. So just take your time. The floor is yours.
I will try to be brief and understand that maybe a break for everybody would be appreciated. So with that said, I am Jeff Fann, the Executive Director of Vermont and EA. Thank you for having me here today to talk about H81, which is a technical adjustment bill to Act 11 from the special session of 2018. And Act 11, there is intent language, but there's not the intent language that some are aspiring to here today. The intent was just to provide equitable health care. It's pretty slim in Act 11. And really what's inspired it was VSBA, the superintendents and principals and business managers were saying in 2017, the year before, that healthcare bargaining was too complex. There were multiple discussions about how complex healthcare was at the local bargaining table. It was too much for local school boards, who were all volunteer, and local educators to bargain together in their respective districts. And so that was the push in 17. We eventually came on board to the thinking in 2018. Maybe we're a little bit slow, but we got there. And Act 11 was passed. And so what's going on here in Act 81 is what we would think of as modest technical adjustments to a new law. That's only, we've had one round of bargaining that concluded in December of 2019 by statute. And those new plans from that decision from the arbitrator just came on board January 1 of this year. So just because of the cycle and that sort of thing, the new plans just came on board last month, or 2 months ago, excuse me. And what we're talking about here in the next round of bargaining.
Mr. Fannin, I just need you to clarify, when you're talking about the new plans, you're talking specifically about healthcare plans.
Just healthcare plans.
Okay.
So the new plans, when I talk about the new healthcare plans for all school employees, was some parts were effective last summer, but in large measure, everything was effective January 1 of 2021, just 2 months ago. And so that's what everybody's now coming on board with these new plans. And incredibly, bargaining begins this April for plans that will become effective January 1, 2023. So for example, the fiscal note today, if you were to request it, would be speculative at best and trying to estimate what the healthcare costs for all school employees will be January 1, 2023, and to a minimum through December 31st, 2025. Right? All agreements have to be no less than 2 years per Act 11, and we're not that's not being proposed to be changed in H81. So, it's very speculative. Healthcare is very costly. We acknowledge that. I think everybody around this table would acknowledge that healthcare is very costly, and certainly Senator Lyons and her committee would acknowledge that and struggles with it. We've been at this for more than a decade, and we think that if we want to have those larger conversations, let's go have them in Senator Lyons' committee and health and welfare and have that rich discussion there. What we're talking about here is a bargaining law, the rules of the road about how the employers, the school boards, provide health insurance for their school employees. And that's what we're talking about here in the process by which we do that. That's what this bill would modify, is the existing law, Act 11, in those rules of the road. So that's all. That's what H81 would do. And it's very similar to S226 from last year that passed the Senate, came out of this committee, Senate Education unanimously, I think it was, appropriations as well, and then on the floor just before the pandemic, and then right afterwards on a voice vote. So it's been pretty well vetted. I think there were 6 revisions last year, S226 that is, and H81 in the House was introduced, was identical to S226. Now there were some changes, modest as they were, in the House General Committee, and then passed with a tri-party vote just a few weeks ago in the House. So it's the real rubbing point, I think, is found in Section 4 of the bill. And my pagination is different than Joe McNeil, so I don't want to tell you what page number it is, but it's Section 4 of H81. And it strikes, it's Section 4 at Section 2103 of Title 16, A3, and that it strikes the language that premium responsibility percentages for each plan tier shall be the same for all participating employees. And it goes on for out-of-pockets as well a little bit later in the same section. So in other words, it strikes the requirement that all school employees, that would be administrators, managers, teachers, and school support staff, bus drivers, cafeteria workers, paraeducators, requiring them all to pay the same amount. And in the first round of bargaining, this teachers and licensed people, as we call them, and the support staff were allowed to pay different premium and out-of-pocket arrangements. Those were permissible in round 1, and the parties did discuss different things, and the arbitrator ultimately decided what he did, and I'll come back to that in a second. But it is different for teachers and support staff right now, currently in law. And every other bargaining law in the state, SELRA, the state employees, the municipal law, doesn't require that employees all pay the same amount. And Joe will respond, and he's correct, that they do in the state employees. All state employees pay the same amount. That is true. But what is not true is the law doesn't require it. The parties bargained that and came to an agreement about that. And so we're asking in it, or what H81 is doing, is allowing the parties to negotiate, like they do in the state employees or the municipal employee law, an arrangement that they can agree to. It might be the same, it might not be. And that's what H81, by striking those 2 sentences, would do, is allow the parties to bargain an arrangement that's different depending on how they see fit. That's it. So that's the real sticking point. It does not cost anything automatically. It strikes language that allows the parties to decide it. So that's the real sticking point. Going to Joe's point about the default language of arbitrator or VLRB, we saw it differently, and Joe is correct. I mean, I sent Joe an email a couple hours ago now. We saw it differently in the House, and we think they got it right, which allows the parties to decide whether they want to go to the labor board or use an arbitrator or a panel of arbitrators. So we think it's right there as it is now in H81 that came through the House. And I'm trying to think a couple other things that were said. Yeah, I mean, I'll try to keep it short and happy to answer any questions. This is a technical correction to a brand new law, Act 11, with changes that in some cases we both sought. So, for example, the arbitrator's decision was lacking a little bit, and we both agreed that there should be more to it. And that's where there is some language about requiring the arbitrator to a bit more elaborate on his or her decision going forward. And we agree with that. That was something that the School Boards Association wanted last year. We agreed to it. That's the language that we think is appropriate. You know, as for cost containment, I think you're right, Senator Chittenden. There's language in the existing law right now, and it doesn't put a finger on the scales to tip it in one side or the other. We think it gets it right, and that's already an existing law. We don't need any, imbalance in the process that would make it unfair inherently. So we don't agree that there's any changes there needed. What we're all struggling with was the arbitrator didn't explain his decision as well as we wanted, or much at all, in fact. That doesn't mean we rewrite the law to fix that. The only thing we did adjust for is requiring the arbitrator to explicate his decision and explain it a bit more. That's the appropriate response to that dearth of a decision that we got from the arbitrator. Perhaps he was tired of us. As Joe mentioned, it was several long days of arbitration hearing, and probably he was tired of seeing everybody in front of him and just wanted to get it over with. I don't know. But now we've got a requirement in H81 that would make the next arbitrator have to explain his or her decision, and we think that's appropriate. So that is, the sum of my testimony, knowing that you folks are pressed for time a little bit, and happy to answer any questions if you might have them. Thank you.
Thank you. Questions for Mr. Fannin? Senator Purcell.
Yeah, thanks. Yeah, Mr. Fannin, when we did the bill walkthrough with James, I had brought up that same thing that Mr. McNeil brought up about what happens if you don't agree on whether it's the panel or the other one, because it doesn't say what happens if you can't agree on that point. How would you see that playing out if there isn't agreement?
Well, I think the parties, not everything is decided in law. I mean, the parties have struggled with other bargaining challenges that aren't decided for them in the existing law, and they get by it. So I think that it's new, but stepping back, we've been doing this. I talked to one of my staff a former elementary school teacher, Suzanne Durmeyer, who will testify tomorrow, and you can ask her this question. We've been doing this for years and years. Not every question is answered and every default is decided in law. We figure it out, and we've been doing it, and I think that'll be the case here. It's a new law, and we think that both sides will figure that out, to be very honest with you, and I think they have to.
Right. Okay.
Okay. Senator Hooker.
Yes, thank you. Thank you, Jeff. One of the big problems here seems to be making sure that the arbitrator is considering the costs. And we're asked to put language in H81. Is it enough to say there's language in Act 11 and make reference to that?
I don't think you need to make reference to it, but I certainly think that because I think it's there in Act 11. And it says the financial ability of the education fund and school districts across the state to pay for the cost of healthcare benefits and coverage. That's something the arbitrator has to consider. And now that we have language requiring the arbitrator to explain the decision, coupled with that language, I think is sufficient. Frankly, I mean, I don't, if you add too much on, it's going to be tipping the scales, and that's what is inherently unfair and not what a bargaining law should be about. It should be about making sure that there's balance in the system, and the arbitrator's got to weigh the financial ability of the ed fund and school districts across the state. I think that's sufficient.
So just comply with the law.
Yes, and the existing law as well as H81, if it
right
is successful, it would require the arbitrator to explain the decision.
Okay, thanks.
Yes, Mr. McNeil, please.
Thank you. Just very briefly in response to Jeff's comment, during the negotiations phase last time, not at last best offer, but during the most of the negotiations phase, the employee side argued that there was no need and really no authority to be considering the cost implications of the bill and the agreement, because Act 11 did not specifically indicate that cost containment or cost control or sustainability was part of that plan. And that, particularly because of change in Act 81, moving from everyone paying at the same percentage for each tier they accept to allowing separate and distinct bargaining on that point. The thinking on the part of VSBA and the employer commissioners was that emphasis on the basic, if you will, balancing of the fulcrum between access on the one hand and reasonable cost consideration on the other is and was appropriate. And Jeff's right. The criteria does certainly say the ability, the financial ability of school districts and education fund to pay. There's a difference, however, between ability in the sense of being able to raise taxes or raise fees and whether it is reasonable to do that given the impacts upon taxpayers and the ed fund and school budgets. And so I'm sorry to be too long on this answer. I'll go down to a B minus, but what we're hoping for is an appropriate balancing between those two fundamental concepts.
Senator Chittenden and then Senator Lyons, please.
I lowered my hand to give Senator Lyons yield to her.
Oh, Senator Lyons, please.
Okay, well, I think when we first started looking at the issue of more of a statewide negotiation for healthcare, we really did believe that it would help improve access while controlling costs. So I think everyone has said that, and everyone is interested in supporting healthcare benefits for teachers and staff. And at the same time, we're all concerned about the cost to our constituents and property taxes. So I think if we're interested in taking another step in looking at healthcare and healthcare reform to reduce costs, that's something that we are doing in our committee. Senator Hooker will be a part of that. It's an ongoing discussion, but I don't think we're going to resolve it with this H81. I honestly don't. It's a tough nut to crack. It's going to continue to be that way, and I shouldn't have left out Senator Terenzini because I'm going to put him to work too. But so that's all I wanted to say. This I think for me this becomes an arbitration bill and resolving some of the issues that we saw during the last negotiation seem important, and it's a work in progress. So keep working on it together.
Thank you for that. Mr. Fannin and then Senator Chittenden.
Oh, I'm sorry. Go ahead, Senator Chittenden. I'm sorry.
This is somewhat of a process question. I'll be quick,
Please.
Jeff. Is my understanding is if we there is some interest in having this passed by April or having it signed by the governor by April 1st. If we change H81, it goes back to the House, and then I don't know. Do we even have time to consider it much, or is that a conversation for later this week when we possibly are considering action on moving this forward? I don't know how much time we have to actually make changes.
I appreciate this question, and I would like Mr. Fannin to also weigh in since he asked that we do take it up this week and started the process prior to break. I can tell you from the corner office, from the Pro Tem's office, we want to do good work. We want to do the best work we possibly can. If that means that senators feel comfortable by the end of the week to advance this, so be it. If senators feel as though they need more time, that's also, I think, will be understood. We also know that this is going to appropriations. So that's just a little bit of from where I'm sitting, and I just want to convey to everyone. I'll let Mr. Fannin mention why he's asked for us to do this right now.
Well, I think it's important. It's a good question, Senator Chittenden. We think time is of the essence because bargaining does begin April 1. And I'm going to go back a little bit. When Act 11 was passed in 2018, we came back in 2019 seeking some of these same changes. We identified some problems early on. And at the time, the School Boards Association Executive Director Nicole Mace said, let's let one round of bargaining go through. Let's let the things simmer down a little bit and figure out what needs adjusting. And that carried the day in 2019. Last year, we came back with some of these same changes, and it got out of the Senate, started in Senate Education. This committee, started that S226, came out of there and went to appropriations, then into the floor, as I said, and was voted out unanimously on a voice vote just before and after the pandemic. And they got stuck in the House, because of that, the pandemic. So we're here on the third year in a row trying to figure out how to adjust the bargaining process, the rules of the road that we bargain. And so by delaying it, to adjust it, it's difficult for me to swallow, but I understand that you want to do the best work you can, as the chair made mention of. So acknowledge that, but time certainly is of the essence if we're going to change this, if the sides are bargaining on it April 1. And they're already starting. I know Joe has had some conversations with some folks in my office about that. So it's already started, and we think, it's time to make the change, we hope. And as for cost, I'm going to go back a step or two.
Please.
In H81, it does, include some new language that would have the sides submitting their arguments and documents and their last best offer to the arbitrator, which would now include a cost estimate for the term of the proposal with a breakdown of costs borne by employers and costs borne by employees. So there's additional requirements now on the employer and the employee side to develop cost estimates for their proposals. So it addresses Joe's stated concern, notwithstanding the language that's in existing law. So I think that, we're trying, this was language that we all kind of agreed to going forward, identifying costs as being important, certainly, but not trying to tip the scale. So we think it reaches the balance of requiring the parties to put forward a bit more information, as well as the arbitrator to make a decision and explain it in better detail than he did in the first round. It's just, we think it strikes the right balance.
Mr. McNeil, you're pushing it.
Thank you.
I'm kidding.
Thank you. Very quickly, with regard to the question of timing, we agree with Jeff that expeditious action is important for negotiation, but we'd also point out that we start negotiating April 1, but by the statute itself, unchanged, we don't reach the impasse part, the meat of this, if we can't reach agreement until about June. So if there is a little bit more time needed to do it right, it's worth it. And then number two, if I could be allowed just a slight 60-minute debate forum back and forth with Jeff, I would say that while it is true that the parties are now compelled to submit evidence on those points, the arbitrator is not compelled to include those points in his decision. He's obligated to give a full explanation, but what we're asking for, very frankly, is he address the points that we're obligated to submit to him or her.
Well, I would just respond and say, Joe, that's right. And I think it's the obligation of the advocate, your case, you, and on my side, my folks, to make that argument to the arbitrator that so that he or she makes the decision based on the information brought forward. So I don't argue the point with you. I just think it's for the arbitrator to decide. And as an advocate, if now you know what you've got the challenge ahead of you is to put forward enough information to make the arbitrator buy your argument and lay it out for him or her. And I think that that's the challenge any advocate has in any forum. And I think we're asking now the arbitrator to explain why he or she decides your way or that way, one way or the other.
And admittedly, that's helpful. We'd like a little bit more. Enough said.
Thank you. Senator Perchlik.
I don't know who the question is for, but can we get clarity on that question? Because it seemed like what I understood and what Mr. McNeil said on the importance of the April 1st date are different in that I assume that once the negotiations started on April 1st, we couldn't change it. It's like the train had already left and we could change the law, but that wouldn't take effect till the next process started. Are you saying, Mr. McNeil, that if we pass the law in May and the negotiations are going on, then that change in statute would fall down upon the negotiations as they're in process?
It would all depend, Senator Perchlik, as to whether the bill took effect from passage. If the bill did take effect from passage, it could have a bearing upon where we were at that point. What I'm trying to say is I think we'll be able to work out the starting aspects of these negotiations. And I was just addressing the point of doing it right or doing it quick. We'd prefer to have it thoroughly looked at, and
right.
That's it.
Is that, Mr. Fannin, your understanding, or?
I think that's right, Senator Perchlik. I think that if we could, in an ideal world, we'd have it done yesterday, right? I mean, and I understand that may not be the case. And so if the law changes, April 2nd, for example, the parties will adapt. And the IRS could change its rules regarding HRAs or HSAs. Parties will have to adapt. And that's outside of the control of even Vermont. So there are other outside influences that the parties perhaps have to keep their eye on. And this could be just another one, and they'd have to figure it out as they will. And the fact finding and the arbitration doesn't happen until August anyway, kind of thing. So it's later in the summer, and the arbitration later in the fall even. So there's time.
And I should just mention, from where I'm sitting, it's an H bill. If we need to, there are certain bills that we have that are must pass by Friday. If we needed an extra day or two next week, we know we have them. I'm certainly not thinking of, continuing this work in April, but again, as the chair, I recognize that there's a little bit more flexibility with this if we need more time. That being said, if there is a champion of this bill on this committee that really feels as though it needs to roll, it's not out of the question that it could roll sometime this week. But I from where I'm sitting right now, it looks like it's possible we might need a little bit more time. Please.
One quick note. I mean, so it's certainly doable, perhaps not ideal, but what we're talking about is folks bringing forward proposals, on April 1 or thereabouts.
Yeah.
For both sides, and it's affecting teachers and support staff alike. But certainly, the change here would affect the lower income support staff, and that's what we're trying to figure this out.
And I just want to make clear, and it's by no means, it's just simply an observation. The House had this bill for, again, just about a month, if not more. And it is an H bill, and in an ideal world, we would have received it a little bit earlier, given the workload, given the pandemic, given the situation out there. So the fact that they did take so long, I put my faith in the fact that they needed to take so long, that it's a complicated issue. And I'll just go back to what the corner office is telling me. We want to pass out the best work possible. And if it takes an extra day or two, and that's just the way it's going to have to be. And I think everybody accepts that.
Absolutely.
Okay.
Thank you.
Thank you. All right, I think we'll leave it there for today. For this topic, we're just going to spend a little more time on one final topic before we leave. Thank you, Ms. Zaglowski, for organizing this, and thank you, Mr. Salzgiver, Mr. McNeil, Mr. Odell, Ms. Burkhart. I think that's everyone, and certainly Mr. Fannin for this important conversation. For those of you who have known Mr. Desmarais, as I have had the honor to know him for several years, this is an important day. Happy birthday. I just heard through the grapevine.
Thank you. Thank you.
Happy birthday. That's awesome.
I hope the day is treating you well as you have continued to treat all of us, that's for sure. Can't thank you enough for everything you continue to do for us, have done for us, and no doubt will be doing for us as we continue.
Well, thank you very much.
An important and interesting year.
It's number 60 for me, so it's a big one.
60, fantastic. Yeah, that's great. That's great. That's great. Well, congratulations and thank you. And I really do hope you have something special planned for this evening. With that, before we let you get to your evening, I'm wondering if you'd be so kind as to talk with us a little bit about a possible strike-all. And to remind senators, we are now transitioning to something we are all familiar with, thanks to our inbox, the waiting study. And this is work that I know this committee worked on last year, and something that I think the corner office would like to see us continue to work on, but there are some outstanding questions that need to be answered. And given the state of affairs in the nation as it relates to the pandemic, as it relates to other pressing issues in this committee and other committees, what I have taken the liberty to do, and please just know that it's just an idea, I have compiled questions that were sent to me by the Pro Tem's office and others, and asked Mr. Desmarais to incorporate them into a draft strike-all, as well as create a committee that would oversee the answering of these questions. And as I believe I wrote to Mr. Desmarais during the week, I think I recommended there be balance from both the House and the Senate, finance committees, education committees, as well as somebody from the state board, completely, of course, open to any changes, edits. And then I believe the way we did it, and Mr. Desmarais will take us through it, is it wouldn't be as though this group would be asking the questions. And what the way I've structured it is an RFP would be given. They would put out an RFP to find somebody to work with them to answer some of these, what I think are outstanding questions, not only from colleagues, but I think around the state before we move too far into assigning weights. So with that, I will not say birthday boy because it doesn't feel right. But Mr. Desmarais, thank you.
Okay, thank you very much. Jean, can I share the screen?
Yes, you can.
Good. Thank you. Okay, so right here. Okay. Okay, bigger. Okay, so for the record, Jim Desmarais, Legislative Counsel, we're walking through a proposed amendment by the committee of S13. It's a strike-all, and it creates this task force on the implementation of the pupil weighting factors report. And the function of the task force broadly is to recommend how to implement the equalized pupil weighting changes outlined in the UVM report. Membership is 6 members, 4 members are from the General Assembly, one from Finance, Senate Finance, one from Senate Education, one from House Ways and Means, and one from House Education, each appointed by the chairs of those committees. And then, in addition to those four, the Secretary of Education or designee, and the chair of the State Board of Education or designee. So the powers and duties are to recommend again how to implement the report, and specifically shall recommend which weighting factors to modify or create and their associated weights, and whether any weight should be eliminated in lieu of use of categorical grants. 2, recommend whether and how to ensure that school districts are using funding to meet education quality standards and improve student outcomes and opportunities. 3, consider education property tax rates and the taxing capacity of school districts and how the task force's weighting factors recommendations relate to the recommendations of the Tax Structure Commission. And I should note here that the Tax Structure Commission issued a report in February of this year, which I will reference more specifically here, in the next draft. 4, recommend how to transition to the new weights to promote equity and ease the financial impact on school districts during the transition, including the availability and use of federal funds during the transition. 5, consider use of categorical aid, including whether a categorical aid should be used instead of some or all of the weighting factors, and if weighting factors are used, whether small school grants, transportation aid, and other state grant funding targeted for a specific purpose should be adjusted or terminated. 6, recommend how tuition rates for non-operating school districts and career technical centers should be adjusted to account for the cost of educating students as reflected in the recommended weights. 7, consider school funding formulas in other states and alternative models for school funding. 8, consider the relationship between the recommended weights and the changes to special education funding under Act 173. And 9, consider the impact of the recommended weights on the goals and outcomes of should be 1997 Action Resolves number 60 and Act 46. The D says that the task force may retain a consultant to assist with executing its powers and duties. The report is due by January 15th of next year to you and to these other committees. And this part's first standard here. The task force would not meet more than 6 times. Administration assistance would come from AOE and usual compensation reimbursement for legislative members. And the appropriation for that is $5,400. And then B has an unknown appropriation for the consultant. And that's it. Effective date is passage.
Thank you, Jim. What I am going to ask Jeannie to do is to put this on the calendar tomorrow for about 15 minutes of a committee discussion. So it'll give senators an opportunity this evening to think about it. I know people have heard from constituents, they've heard from colleagues, and it's just one idea in terms of how to move forward with this, keep the conversation alive, which I think is important. Senator Lyons.
So, yeah, I mean, there are differing opinions out there in our district. Some want us to just go forward as quickly as we can, but then there are also people who understand that we need to take some time on this. I had a meeting on, I don't remember when it was, last week, an early morning meeting with some of our school folks, and they did get it. The people who understand what weighting means understand the need to take some time.
Yeah.
It's the people who don't understand this who think we should move a little bit faster. The question I have is, we did go through the development of per pupil cost and an analysis of where the weighting fits. And I'm wondering if maybe we don't need to do it again, but it would be nice to have a quick review or a single sheet that would help us just look at that, and how the proposals within the bill, the questions that are being asked in the bill, actually are influencing the final decision. So in other words, categorical funding or grants, and why are we putting that in there? So some justification for our decisions. And I know that we know that they're there, and I know that we probably intuitively can answer all of those questions, but we also know that funding is not totally intuitive. So, and it doesn't have to happen before we finish our work on this, but it would be helpful at some point over the next week or so, just to look at it while it's going down the hall.
I think that's a very good point. Mr. Demeray.
So I had presented earlier, it's been a while now, on how the weights work. There's a PowerPoint that I did for you. I could bring that back if you want and just run through how the current weights work.
That would be great. I mean, just a quick refresher would be awesome. Yeah.
I think that's a great idea. We've been involved in a lot of different topics, and I think it would be great for all of us to have that review, if you'd be so kind as to do that. And I'll work with Jeannie to find a time.
Sure. Yeah.
Senator Hooker, I'm sorry, I didn't see your hand.
Thank you. I understand the need to want to do this right, and I think Senator Lyons is correct in saying that people who understand the weighting process realize that it takes time and stuff. But I am getting more and more emails from districts that are saying, we need this. We've been losing money. And so with regard to things like categorical funding and the like, will we be looking at other ways to help sort of bridge this time between now and when we come to an agreement on weighting?
And my answer to that is absolutely. Even if, as this moves down the hall to, I think both it would go to appropriations and finance, we would indeed. We would be working with appropriations and AOE to identify those areas, those districts, if you will, those schools that would need support. So yeah, I think this is an ongoing conversation and ongoing work post crossover. I think what just generally out there, I think constituents, Vermonters, don't want the work to disappear. Not even if this were not to go forward, it wouldn't disappear. There are other ways to advance this, but given that there might be an opportunity to do some additional work over the summer, and these questions are coming up. I mean, these questions are questions from our colleagues, but we also know they're out there, and they would end up being asked on the floor, some of them. And so let's try to do our due diligence before we take these next steps. Okay, so we'll find some time tomorrow, just 15 minutes, just to sort of, if everyone would just come back in, and having taken a look at this and marinated on it a little bit, and then knowing that this would likely need to leave by Friday, and we have a little bit more time with H81. I am going to make those adjustments accordingly in our agenda, and I'll talk to Jeannie a little bit about that. Okay, with that, Mr. Demeray, again, happy 60th. Hope it's a wonderful evening.